its hearing on the Subcommittee D on the Committee on Finance on the proposed budget for fiscal year 2022 of the NEP of DOH and its attached agency. So we will call on Senator Joel Villanueva first, and then we will proceed with the other senators. So without further ado, I will no longer recognize all the members of the DOH family. Of course, Secretary Duque is here with us, and I have not seen, but of course I assume that Attorney Iran of PhilHealth is also here with us, and the rest of the DOH family. So without further ado, Senator Villanueva, go ahead and take the floor.
Thank you, Madam Chair. Appreciate it. Again, good afternoon to everyone. Thank you, Madam Chair. I'll go straight to the point, Secretary Duque. I remember discussing last time yung unfilled positions ng DOH. There are 14,294 unfilled positions in DOH. I'm looking at the budget. There's 3.8 billion also still being allotted for human resources for health, yung emergency hiring po. Gusto lang natin malaman ano na po yung status nitong 14,294. Also, we would like to know how many emergency hires will be needed for 2022, sir.
Madam Chair, good afternoon to everyone. First, let me just give an update insofar as the number of total plantilla positions is concerned. That's for 2021, we have 80,808, and total filled position is 66,567, and a difference of 14,241 positions which are still unfilled. Now, the budgetary cost of this unfilled plantilla position is about 9 billion, Madam Chairperson, thereabouts. So this amount is further broken down into, well, the DBM, I have been told, has released a total of 7.4 billion, thereabouts, and of which 5.1 billion will be lump sum of filling of position in case these positions will be filled. So there's a balance of 1.5 billion, Madam Chair, and these amounts can actually be used for benefit provisions. And so that's where we are at the moment, no? So yun ang yung sa emergency hiring, we have the following figures. We have 10,120 HRH augmentation under emergency hiring. The total amount required is about 1.5 billion, thereabouts. The vaccination program, that's 4,800 personnel with a total budgetary requirement of about 1,034 million.
Sige. Secretary, just to be clarified, no, yung kanina unfilled positions, may budget po yan na 9 billion. And we have a catch-up plan, what to do with it. How many will be filled in the next, perhaps in the coming year?
We are collating the hiring plan of our different operating units, the hospitals in particular. So a lot of these unfilled plantilla positions are for physicians or doctors.
So, Secretary, I remember during the time we were discussing yung arrangement or perhaps the discussions with Civil Service Commission to expedite the processing of civil service eligibilities of qualified healthcare workers so that they can be hired under authorized plantilla position instead of contract of service positions. May update na po ba tayo dito?
None yet, Madam Chair, but we will follow up. And ito naman kasing yung eligibility nila is already part of their qualification standards. It's pretty much established. It's either you are qualified in terms of education, training, experience, and there's one more. I forget. Eligibility, training, experience, and there's one more.
So
Yeah,
it's not
which is
really
catching up.
hindering, Secretary, it's not really hindering the agency, the department, not to fill these positions because of CSC guidelines.
Hindi naman kundi talagang minsan kulang talaga yung qualifications, one of the reasons. Second, yung mga doktor ayaw i-give up yung private practice. Gusto nila part-time. Hindi naman natin pwedeng gawin unless of course under compelling circumstances kung asa GIDA areas or talagang lugar na walang mga doktor. Sometimes we give leeway for them to while practicing privately, they can serve in
Sige.
government facilities.
Sige, Secretary, I'll move forward. No, binanggit nyo kanina dun sa emergency hires, that's about 10,000 plus. Kasama po ito sa proposed budget ninyo?
Yes, Madam Chair, that is
Okay.
correct.
So wala na tayong kailangan doon, no. Yung isa pong I remember during the budget up in Blue Ribbon na hearing, yung recommendation po natin, Secretary, to extend the contracts of HRH personnel to at least 1 year, given that we cannot determine that we are nearing the end of the pandemic. Ano pong status din ito?
We are extending the contracts
Okay.
of these personnel.
1 year po yung extension,
Madam Chair.
Secretary? 1 year po?
It is every 6 months kasi this
Okay.
will also
Sige po, sige. I'm monitoring this, Secretary, kasi I feel na maraming po pwedeng magkatrabaho, at least alam natin hindi pa tapos itong pandemya. Now, will the temporary hires, Secretary, just for the record, will the temporary hires also be entitled to SRA, hazard duty pay, and other allowances usually given to healthcare workers that are exposed to COVID-19 patients?
Madam Chair, they are all included under this benefit provision.
Yes. Secretary, let me go forward dun sa pre-service medical scholarship. Very close to our hearts, the chairperson, Senator Pia ito. How many DOH scholars are now doctors? And how many were employed by DOH thereafter?
Can you just give me a little time to
Sige po.
get the data?
Tapos
Thank you,
siguro
Madam
gusto
Chair.
din natin malaman, Secretary, kung this year, no, with the implementation of Doktor para sa Bayan Act, na synchronize na po natin yung efforts ng Department of Health and Commission on Higher Education. Gusto lang natin malaman kung nasan na po tayo, and we are closely monitoring kasi may ilang items po doon sa batas na ating ipinasa ng Senado, ng Kongreso, na hanggang ngayon po naka-FLR pa daw po.
Just to answer the question, as of October 19, 2021, there are about 2,218 DOH scholars, and of these, 1,428 are medical scholars, while 790 are taking up other courses, like midwifery.
Okay.
73% of these scholars are from the GIDA and indigenous people's communities and GIDA areas.
So, just to be clarified, Secretary, 1,048 dito yung medical scholars. 1,048.
Correct, Madam Chair. That is correct.
Yes. Tapos siguro yung mamaya na lang malaman natin, Secretary, how many were employed by DOH thereafter itong mga nakaraan. Kasi di ba yung sa Doktor para sa Bayan Act na nag-start ng implementation this year, part of the law states that we will be able to hire them and magbigay tayo ng items sa kanila para ma-attain natin yung malaking gap ng ating doctor to patient ratio.
Madam Chair, the graduates of the scholarship program are employed under the Doctors to the Barrio program, or DTTB. And out of the 109 medical graduates in 2020 and 153 in 2021, 102 are currently under the DTTB program. However, due to the cancellation of the physicians' licensure exams in some areas in the country because of the restrictions brought about by community quarantines, some of the graduates in 2021 were not able to take the board exam. And in spite of this, 57 passed the September 2021 licensure exams and are now deployed as will be deployed in January 22, while the rest of the graduates will take the physician licensure exam next year. Thank you, Madam Chair.
Okay, thank you, Secretary. Just for the sake of discussion na rin, Secretary, has DOH ensured that our regions have at least one level 3 DOH hospital to ensure the availability naman po of a possible partnership or possible base hospital of our medical schools? Because when we pass this measure, itong Doktor para sa Bayan, 10 regions in the country, wala po ni isa na medical school, no, SUC offering School of Medicine. Right now, there are about 2. Yung USEP, for instance, nag-launch na po sila, I think, a couple of weeks ago. We just wanted to find out ano po yung status nito, Secretary.
Yung po kasing level 3 hospitals, they are in accordance with our Philippine Health Facility Development Plan. We need to review this and anchor to this the requirement for the base hospitals that medical students require, and also for their further residency training. But my humble suggestion, Madam Chair, is perhaps where there is a gap in terms of the level 3 hospitals, or in fact, if there's also a gap in terms of the medical schools, it might be good to look into the private sector capacity. And we can probably spend more wisely limited resources if you bring them into the fold, just as the National Health Insurance Program accredits private hospitals, not just public hospitals, to expand capacity without having to worry to spend on very costly infrastructure facilities.
Yes. That's one option, Secretary. I agree with you. That's one option with the private sector. But if you go with the public, I'm asking that question because perhaps we need to coordinate with DBM. For example, if there's a need for creation of plantilla positions for our scholar physicians, di ba? Kasi as we move forward, nagpo-produce tayo ng mga doctors, kailangan din naman natin ng physicians, and ito magagamit din po natin for level 3 DOH hospitals. I just want to put that on record, Your Honor, Secretary. Another thing that I'd like to raise, I'll be quick lang po. Itong I remember last hearing, si Asad Beltran mentioned that DOH already requested the DBM doon po sa, yes?
Yeah, no, if you're going to move to another topic, can I just
Yes,
make an
yes,
intervention on
Yes,
our common concern and passion for the full implementation of Doktor para sa Bayan Act, no? I'll also mention the name of our Senate President, Tito Soto, and our Majority Floor Leader, Mig Subiri, who were also authors of this measure. Just to add, Secretary, this is very important, and I think I would like you to be present tomorrow in the CHED hearing. Senator Joel, I'm sure you'll be there, no? Can you take this up during the CHED hearing? And I would like Secretary Duque to be there, sir. We can give
Sorry, Madam Chair, we can't hear you.
Na-mute si Senator Pia.
Wala po siya.
Oo nga po, parang karoon ng problema yung connection niya. But I think Secretary Duque, what the chairperson would like to request tomorrow kasi yung sa CHED, and may mga ilang items na in FLR, may ilang items na kailangang masiguro natin na we keep on going at for the implementation of this very important law na inaasahan ng lahat na magbibigay ng malaking tulong sa atin, especially in producing medical doctors.
Madam Chair, I will be there promptly for tomorrow's CHAD meeting. So Senator Joel, I will be there.
Thank you.
Yes.
Thank you, Secretary Duque. Baka pwede na rin pong ma-anticipate yung mga possible questions that will be raised kasi yun lang naman po yun, no? Yung synchronization ng CHED and DOH efforts sa medical scholarship program and return service. May mga schools po na start na yung na-credit na po sila. Tapos this coming year, may mga ilan din pong applicants na tutugunan natin yung application po nila. CHED, we're saying there are about 2 or 3 na po pwedeng makapag-offer din ng School of Medicine because remember before this law was passed, talagang 0 out of 10 po, 10 regions, wala po ni isa. Ay, andyan na si Madam Chair. Madam Chair, sorry. We
Sorry
lost your
about
connection,
that.
sorry.
Yeah, sorry about that. Thank you for carrying on, Senator Joel. So I was just saying, Secretary Duque, I would like your presence tomorrow when Senator Joel does his post his questions to CHED, particularly with the implementation of the Doktor para sa Bayan. Because when I had prior to the briefing, I committed to our chairman, no, on the Committee on Higher Education, Senator Joel, that I'll be the one to follow up on this budget. And Secretary, I want you to know that I was shocked. I was shocked to find out that at first the information I had was na FLR yung budget ng Doktor para sa Bayan. And I reported that also to the Senate President. However, upon further scrutiny, it turns out that the guidelines for the seed fund, no, for the implementation of the law and the construction and the support that we were going to give to the medical schools, including the IRR of Doktor para sa Bayan, was passed only on September 7. September 7, a month ago. A month ago, like what? More than a year after we passed the law and about 10 months after we finalized during the budget committee hearings that we were going to implement this full on. And then the request for SARO was submitted on September 9, not by, to be clear, by CHED. So this is not on you. I'm letting you know, I have been diligently following up. I hope there was also somebody from your office who was doing the same. But this is the situation we are in, with CHED not finding this as urgent as everyone else in this hearing has been. Now, I understand the intervention that the Secretary was making, that down the road, we can come up similar dun sa tulong-dulong and test programs, Senator Joel, no, wherein we make use of the private sector. Okay lang ako dyan. But I also support Senator Joel's initial position on this na let's secure naman na per region, that is the goal, but then we can also supplement this with partnerships, di ba? But I understand what you're saying, Secretary, na baka in the meantime, we can already have these partnerships, no problem there. But let's secure that we have this regionally. But how can we even begin to secure it when there seems to be no sense of urgency on the part of CHED to get this going? It just really boggles my mind, and I was so shocked. And I felt so bad because I had made this commitment to our colleagues na akong bahala dito. Hinimay-himay ko yung budget na yan para magkaroon ng pondo itong bawat isang SUC na magpapalaki ng kanilang capacity to enroll the students. Tapos, September 7 lang? I mean, Mr. Secretary, siguro baka you can give us a response here kasi kayo naman on the technical side, right? Ba't inabot naman ng ganyan si Ched? Do you know anything about this, Secretary? Kasi you should know naman something din naman. Kasi these are medical schools that would produce your doctors.
Madam Chair, thank you. We have been pushing for this. We know the importance and the strategic thrust of such a program. And I will talk to the chairman and I will ask him if this can be further pushed more aggressively. And I will be there tomorrow during the hearing, but I'll make sure I get to talk to him after our briefing today, Madam Chair.
O sige, kasi just to mention also, although wala na itong sigurong kinalaman well, hindi naman walang kinalaman, but maybe vaguely connected na dito sa DOH budget natin, but Senator Joel, yung smart campuses mo, lahat din yan. Late na rin nila na just anyway, take it up tomorrow. I mention it because, we're all in the digital age din naman, di ba? And itong smart campuses would also be helping these medical schools conduct their better classes. I would love if the provincial medical schools would have access to the best of the best in PGH, in Cebu doctors, right? And yet, hindi man lang mabigay ng, I think 3 million each lang yung ibibigay. Hindi man lang, nabigay na yata, Senator Joel, just pursue that tomorrow, okay? Nabigay yan parang last month lang. And now, wala na silang time to obligate. Hindi na nila, unless we can make some miraculous intervention with DBM. I'm so disappointed in how this is being handled by Ched. So anyway, I give you back the floor. I just needed to put that on the record because it directly affects your capacity, Secretary, to produce the doctors that is part of your mandate. Maraming salamat. Go ahead, Senator Joel.
Thank you very much, Senator Bia, our chair, especially for taking the cudgels and helping us out in looking for funds and ensuring that we'll be able to implement the law that we passed. Lahat tayo naghirap po, si Senator Ping Lacson, Senator Risa Ontiveros, work hard for this. Yung 3 billion na smart campuses, we all work hard for it. Nung bayanihan to, just for the record, as we are asking our friends from CHED, 250 million po yung for later release na scholarship and 150 million naman dun po sa seed fund for our SUCs applying for medical scholarship program. I will proceed and I'm almost done, Your Honors. Thank you for your patience. Yung question ko kanina kay Asek Beltran kasi she mentioned before yung I think last hearing yung request po ng DOH from DBM dun sa SRA for around 85,000 na healthcare workers. May we know the update now, ma'am, Asek Beltran?
Madam Chair, kindly recognize Asek Beltran, Madam Chair.
Yes, good afternoon po. Good afternoon po, Madam Chairman and Senator and colleagues from UH. Thank you very much, Secretary. Sir, ang update po ngayon, for SRA, Special Risk Allowance, we already have provided 456,013 healthcare workers, or in short, 87% of our estimated 526,727 eligible potential healthcare workers po. So as of now po, we are still processing 13%, which is around 70,714 of the total 526,727, Madam Chairman. And then we already have given our request to DBM with some supplemental justification and supporting papers submitted to DBM last October 15 for another total amount of 2.7 billion. to cover additional healthcare workers, which has been requested by the various healthcare facilities po. So we're still awaiting, Madam Chairman, the response from DBM because this is still being reviewed by them. Given that we submitted our justification and financial status of what has been released to us. So we're still awaiting, in short,
Okay.
Madam Chairman. Thank you.
Asek Beltran, yung
Madam-
70,000 means 70,000 hindi pa ho nakakatanggap, no? Dun sa original denominator mo na 526,000. Tapos,
Yes.
so hindi pa sila nakakatanggap. Tapos may hinihingi po kayong 2.7 billion sa additional list. This is on top of the 526,000.
Yes, Mr. Senator.
Ilan
That's
po yun?
right.
Ilan po yun? Mga ilan po yun? Yung sa 2.7 billion pa.
Sir, yung total po na in excess already of the 526,727 is 119,353 healthcare workers po. That's already on top of our 526,727.
Okay. Thank you, thank you. I think Senator Lacson, Madam Chair, would like to intervene.
Yeah, I would just like to find out from DOH, what challenges did you face or are still facing? Bakit naiwan itong 70,714 or more than 70,000 health workers? Bakit hanggang ngayon hindi sila nakatanggap ng SRA? Gusto lang namin malaman ano yung challenges or issues that you faced or are still facing.
Sir? Yes, sir. Sir, of the 70,714 na binanggit ko po, now which is still part of the 526,727, 41,587 are already being processed po. Yung mga challenges po na which are being faced by our operating units, like the Centers for Health Development, it's because of the lack of supporting documents po, specifically from our LGU hospitals as well as private healthcare facilities. Supporting documents po would be memorandum of agreements because we cannot download po to these healthcare facilities which are beyond the Department of Health and which are public healthcare facilities at the LGU level as well as private hospitals. So we need an MOU po.
So these
Memorandum of understanding or memorandum of agreement po.
So these are purely administrative issues.
Yes, sir.
Thank you, ma'am.
Yes po. Thank you po.
Senator Ping, one last point po dito, yung 119,353, ito po yung hindi directly exposed sa COVID patients, is that correct?
Mr. Senator, Madam Chairman, these are actually the list coming from our operating units. Some or most of them are directly or of course indirectly catering to the COVID patients po. But validation has been done by the Centers for Health Development. So any requests that we're getting, sir, are coming from our operating units and our Centers for Health Development.
Okay. Thank you. So ibig sabihin parang na-delay lang po, no? Sige, thank you. Madam Chair, I will terminate my interpellations and asking of questions. If I may just ask and request for DOH to submit to the committee performance report of One Hospital Command Center. We wanted to find out yung update po dun sa One Hospital Command Center. Tapos po yung number of emergency hires po sana for 2022, the type of jobs and the duration of employment that will be created with the proposed health emergency hiring. Yun lang po sana yung hilingin nating document sa kanila. Maraming salamat, Madam Chair, dear colleagues. Thank you for your patience.
Sige, we request those documents to be sent to our office so we can give it to Senator Joel. Senator Pin, yes?
Yes, a little clarification. Itong 119,353 on top of the 526, saan po nanggaling ito?
Sir, may I? Thank you po. Sir, these are from the various operating units po. Both public, local government healthcare facilities po and private hospitals or private healthcare facilities po, including laboratories and hospitals po.
Would this include the personnel that we referred to during the last hearing? Ito yung mga hindi nasama like janitors, yung nagdi-dispose ng waste. Kasama na ba sila dito sa 119?
Sir, Mr. Senator, upon our checking, some utility workers have been included in the list and other administrative support staff po, as requested
Yes.
po by our healthcare facilities.
So inclusive na yon dito sa 119,000 plus.
Yes, sir. Pero baka may mga hindi pa rin ho na-include, sir. I'm not sure if it's really 100% po, but upon checking po,
Yeah.
there are already utility workers slash mga non-medical and allied medical personnel na po na naka-include po.
Yeah, I understand po. So yung mga naka-outsource, consider nyo na rin or hindi kasama rin sa 119? Yung sinabi ni Secretary Duque last time, ang problema kasi, ano ito contractual, naka-contract ito, naka-outsource. So how would you treat them?
Sir, pinag-aaralan pa ho namin yung outsourced personnel, but for this particular period po, because we're paying for the period December 2020 up to June 30, 2021 po, per batas po na pinag-aangklahan ho namin, hindi pa ho kasama yung outsourced personnel, Senator.
Yeah,
But of course, iba ho yung 2022
yeah,
proposal.
may problems kayong harapin. So siguro pag nag-outsource yung mga hospitals, advice na lang natin na isama na nila doon sa kanilang contract yung parang SRA type assistance to their personnel.
Okay po, Senator.
Thank
We
you.
will consider po. Thank you
Thank
po.
you very much. Thank you.
Madam
Thank you,
Chair.
Madam Chairman.
Actually, Senator Risa, you're next.
Oh, okay. Salamat, Madam Chair. But just first of all, I'd like to join in the following up of SENPING of this issue. Just for the record, Madam Chair, last 18th October, nagpulong po yung opisina ko at si ASEC Maylin para lang linawin yung panukala ko na isama nga yung non-licensed health facility workers, orderly, security, utility workers, at yung ibang binanggit ni Senping, isama sila dun sa special COVID-19 allowance. So just for the record, Madam Chair, among other points, dun sa pag-uusap, nilinaw namin na DOH is still doing or will still do a master listing of all employees or workers based on their parameters. And lastly, it was also our understanding that DOH could explore other possible financial assistance to those who will not be covered as of now, lalo na pa yung mga in-outsource at saka agency hired. So, right at the start, Madam Chair, just for the record, and salamat muli kay ASEC Maylin for meeting with my office to continue to discuss these points. So, yung una kong tanong, Madam Chair, tungkol sa COVID-19 National Vaccination Program. Actually, hindi pala tanong ito, Madam Chair, for the record din lamang. Salamat sa DOH sa pag-submit nila nung requested data on the procured COVID-19 vaccines. Kaya lang, yung natanggap po natin ay breakdown lang ng mga doses per manufacturer at saka breakdown ng mga funding source. So wala pa rin pong estimated cost per purchase gaya ng kinumit ni Secretary of Health nung nakaraang hearing. So gusto ko lang i-reiterate for the record, Madam Chair, na yung requested data ay isubmit po nila sa ating komite through the chair. I so move or I respectfully request again, Madam Chair.
Secretary, is there a problem providing the information? Just to be clear, kasi Hindi pala natanggap.
Thank you, Madam Chair. We are seeking clearance. As soon as we can get this clearance, we will give the data that is asked of us. This is a remaining portion of the overall information requested of us. Yun na lang pricing per dose per vaccine. These are covered under the NDA, but I will communicate to the Department of Finance that this is the requirement. This is the requirement of the Senate and that we must comply. Thank you, Madam Chair.
Salamat, Secretary. Salamat, Madam Chair. At least for that stated intention, or at least that stated concurrence that the department must comply to the committee of the Senate. Kasi gaya ng sinabi na rin po natin nung nakaraang hearing, Madam Chair, sinabi din ng Minority Leader, consummated na po yung transaction nakapagbayad na rin po yung gobyerno natin para sa vaccine. So, hindi ko pa rin maintindihan o matanggap yung kondisyon na kailangan may clearance pa ng DOF tungkol doon sa non-disclosure agreement. Kasi tapos na po yung transaction So matter of fact na lang dapat. Yes, it's the only remaining fact na kulang pa sa hinihinging impormasyon, but it remains now the most important para mabuo natin sa Senado yung picture kung magkano at maayos ba na ginastos yung pondo natin para sa vaccine. So I await that last bit and very important information, Madam Chair, from the department. Salamat. Moving on now, Madam Chair, dun sa COVID-19 PhilHealth benefit packages. Isa po kasi sa mga madalas namin matanggap na reklamo ay hindi daw covered ng inpatient benefit care packages. Yung mga confirmed COVID-19 patients na di naman nila kasalanan, hindi mabigyan ng kwarto sa mga ospital dahil walang available, yet they were given treatment in the emergency area or kung saan mang bahagi ng ospital or even right outside the hospital. Yung iba po sa kanila, dahil sa level of hospital available at accessible sa kanila, kahit na sa clinical diagnosis ng doktor ay critical na or severe pa nga, di pa rin nakapag-avail ng appropriate benefits. So, ang tanong ko po ay, may one-stop shop ba ang PhilHealth para i-address itong mga concerns para naman ma-resolve at maka-benepisyo yung mga kababayan natin? So, may one-stop shop po ba at ano pa po kung mayroon ang ginagawa ng PhilHealth para tugunan yung ganito pong mga concerns?
Madam Chair, I would like to request that PhilHealth be recognized, Attorney Dante Garan. But what I recall is that this particular complaint that is being mentioned or highlighted by Senator Risa, this was already addressed. Na isinama kahit na nalagay, for example, sa tent, doon sa area na nag-umpisa na po yung care, dapat yun ay kasama na po doon sa COVID PhilHealth benefit package. Hindi pwedeng sasabihin lang na kailangan makapasok sa kwarto muna, kung hindi even prior to the admission to a room, kailangan yung care na yun is already covered by the PhilHealth benefit package. But I think the best person to answer this would be PhilHealth. Madam Chairperson, if you may please, thank you.
Salamat, Secretary. Yes, Madam Chair, and baka pwede na ring isama ni PhilHealth President Geran kung meron na nga po ba at ilan ba sila mga kababayan natin naka-avail of nung PhilHealth benefits nila kahit nasa labas ng proper hospital room sila being treated for COVID.
Yes. Please proceed. President Giran.
Madam Chair, can I please refer this question to Dr. Clim Bautista po?
Dr. Bautista, please proceed.
Doctor, hindi ko kayo halos marinig.
Good afternoon. Can you hear me na po?
Yes, ma'am.
Yes.
Better na po.
Pero medyo mahina pa rin, ano? Maybe
Oo nga po,
close to the
Chair.
mic. Medyo sabog yung voice ng konti.
Mm-mm.
Yeah. As to the question po, meron po kaming mga nakadeploy na PCares at saka malasakit personnel dun po sa mga hospitals kung saan pwede po doon available po sila para sa mga miyembro, tulungan po yung mga members ng PhilHealth. Basically, lahat na po yan ng Pilipino because we all are members naman po ng PhilHealth. So yun po, nakadeploy po sila sa hospitals, malasakit personnel po doon sa mga DOH retained hospitals at saka doon naman po sa mga private hospitals, may mga PCares po dyan. If ever po wala sila physically, they usually nag-iiwan po sila ng contact number sa mga hospitals so that they could be contacted by the members po. And also, we also have a hotline, ang Action Center po namin kung saan pwede pong magtanong doon ang mga members anytime po. I think we are also open 8 to 5. Yun po, Monday to Friday.
Dr. Bautista, before my follow-up questions, pwede pong buksan yung video nyo para lang magkita-kita tayong lahat. And then matanong lang, ma'am, kayo po ay sa PhilHealth, hindi po kasi nabanggit ni President Geran, VP kayo for what, ma'am? Ano pong tungkulin nyo sa PhilHealth?
For ngayon po designated po ako sa health finance and policy sector po.
Okay, salamat, Doctor. Doctor po kayo, no? Did I hear right?
Yes, ma'am.
Dr. Bautista. Doctor,
Yes, ma'am.
naalala ko po yung PCares, early innovation na po yun sa PhilHealth, and yung malasakit officers din ay bagamat mas of recent vintage, pre-pandemic rin po iyon. Pero could you give us an idea po in terms of numbers nung mga PhilHealth members natin na na-diagnose with COVID of different severities na kahit wala po sila sa kwarto, nandun sila sa ER or even in other areas or right outside the hospital, na dahil binigyan ng COVID care ay eto nga po na hindi na nagkaroon ng problema sa pag-avail ng kanilang PhilHealth benefits pero naka-avail of na po. Meron na po ba kayong datos para dyan?
Unfortunately po, we don't have the data right now, but we can submit po the data to you po.
Please do po, Dr. Bautista. I'd appreciate that kasi otherwise, baka manatiling anekdota lang yung sinabi ni Sec Duque kanina. We really would like to know na in fact, na sosolusyonan na yung problema na inirereklamo sa atin and that there are indeed these numbers of mga kababayan natin na nakaka-avail of ng benefit package for COVID kahit sa labas ng hospital room. Pero within the hospital, under the hospital's care. So, intayin ko po, Dr. Bautista, yung data po na yon. So, aside po dun sa binanggit yung PCares, malasakit personnel, hotline, ito po yung mga ginagawa ng PhilHealth as you're telling us to respond to these concerns. Wala pong one-stop shop. Wala pong for that particular problem na sa gitna ng pandemya, yung ibang miyembro natin hindi nakaka-avail na dun sila pwedeng tumawag at makakuha ng assistance. Wala pong ganon.
Ma'am, for one nga po, yun pong malasakit personnel
Okay.
ay naka-station po yan siya doon sa malasakit center wherein this is actually considered a one-stop shop for kaya lang po ito ay mga naka-deploy lang po sa DOH retained hospital. So,
Ayun na nga po.
if they have problems po with access to health services, they could go to this one-stop shop of the PhilHealth, DOH, and DSWD. On the other hand pa po, meron din po kaming public advisory na naka-post po sa aming website yan, and I think ang amin pong corporate affairs group is also doing information campaign on this, such that we've issued advisory 2021-028, kung saan po nasabi po namin doon na we are covering patients admitted in the emergency room or doon po sa mga tents in certain areas na kailangan po yan, especially during surge, na yan po ay aming binabayaran.
Okay, salamat po, Dr. Bautista. It's good to know about that advisory. Then of course, yung mga malasakit personnel and for that matter, yung mga PCares, syempre ay nakadeploy sa any and all na PhilHealth concerns ng ating mga miyembro. So maybe if you could consider it na lang as a question or a suggestion, yung one-stop shop para dun sa yung namomroblema pa rin sa pag-avail of ng PhilHealth coverage nila kung hindi sila nasa hospital room. But in any case, abangan din po namin yung data that you will submit to us about ilan na ang nakaka-avail of kahit wala sa hospital room mismo within the hospital. Sige ma'am, doctor, moving on po dun sa benefits utilization. Aware po ako na nag-roll out ang PhilHealth ng iba't ibang benefit packages para sa COVID-19. So alam din po natin na to date, may 2.7 million plus na mga Pilipino ang nagpositibo sa COVID. Pwede po ba ako mag-request sa PhilHealth na iulat sa amin yung breakdown ng benefit payments related sa COVID-19 packages mula nung i-roll out yung mga packages na ito?
Based po sa aming data as of October 6, 2021, meron po kaming mga nabayaran na sa isolation package po namin about 516 million. And then for inpatient, nabayaran na po namin is about 6 billion pesos. For testing package, it's at 11 billion. So all in all po, 18 billion po yung nabayaran ng PhilHealth as of October 6.
Salamat, Doctor. And that would be for how many members of the corporation?
Okay. Ang claims po ng na yan ay nag-a-account po sa 3,693,000 claims po.
3,693,000 claims.
96,779 to be exact.
779. Okay po. So it would appear na bawat isa ng possibly, just numerically, possibly the 2.7 million na nagpositibo na sa COVID-19 ay posibleng nag-avail of ng at least one of the benefit packages. Well, at least yung isolation or the inpatient package. Siyempre, bukod pa po yung testing package.
Testing,
Ano
yes.
po? Kasi yung ibang nag-test ay nag-test negative.
Tama
Sige
po.
Sige po.
Tama po.
Sana po pwede niyong isubmit in writing sa aming komite itong mga data na ito para din i-disaggregate na dun sa 2.7 million na nag-test positive so far, ilan na ang nakabenepisyo dun sa testing, sa home isolation at community isolation din, tapos sa inpatient care, plus if any sa vaccine injury compensation.
Ako po. Okay po.
Salamat po.
Madam Chair, can I just add
Yes,
a little more
Secretary.
information, Madam Chair? Yes po.
Madam Chair.
Yung amount na 18 billion na binayaran ng PhilHealth, yung pong total claims kasi nito is 3.6 million claims. That would be an average of the testing, the actual hospital admission, the isolation package. All told, that would be about 5,000 per claim, which is about half of the national average value per claim of 10,000. Yun lang po. Thank you.
Sorry, Secretary, it's half of the national value of what?
Average value per claim ng PhilHealth payouts, which is about 10,000 per claim, average value per claim. So ito po, lumalabas based on the figures that was mentioned, parang 5,000 po. Kung 18 billion, you divide that by 3.6 million claims, parang 5,000 po per claim. Yun lang po, Madam Chair. Thank you.
Alright, salamat po, Secretary and Madam Chair.
Senator Risa, last question.
Yes, Madam Chair.
A minute.
Yes, Madam Chair. Then I can just, if there will be a second round, I'll join that again, Madam Chair. Salamat.
Second round na to.
Okay po. Oo nga pala, Madam Chair. Second round na nga pala. Sige po, my last question for this round then will be on the Philippine HIV and AIDS policy. The first topic of budget for continuum care interventions. Kasi po yung DOH target ay i-improve yung access sa HIV and AIDS preventive, curative healthcare services, pati rehabilitative and restorative care. Pero walang line item budget na napapansin para i-implementa yung actual service delivery ng continuum healthcare para sa HIV and AIDS program. So, pwede ko bang i-request sa DOH na ipresenta sa atin yung budget allocated for actual healthcare service delivery for HIV and AIDS program? Yung particular na tanong ay, saan ba nakalagay sa ahensya yung mga pondo para sa HIV and AIDS programs and interventions?
Madam Chair, may I request that Yusek Vergere be recognized for her rejoinder. Thank you, Madam Chair.
Yeah, Yusek for help, please. Go ahead.
Yes, good afternoon, Madam Chair, and to Senator Ontiveros. For the HIV program, Senator, we only procure commodities, and for the other services, it is being funded or coursed through the PhilHealth benefit package for HIV, which is the OHA.
All right, salamat po, Yusek. I'll just follow that up. Can I take that now? Wait. Okay, I'll just follow that up in the next round, Madam Chair, both with PhilHealth and the PNAC, the Philippine National AIDS Council. Kasi yun may malinaw na budget item, but it's not a program delivery item. It's just for the secretariat. So maraming salamat, Madam Chair, and to our resource persons. I suspend my interpellation.
We'll ask PNAC to be on standby for,
Thank you, Madam Chair,
for your third round. Anyway, for now, it's Senator Ping Lacson who is next. Actually, he was here. There you are, sir. You're next,
Yeah.
and then Senator Binay, and then if there's no one else who comes online, Senator Hontiveros, we can go back to you right away. So, Senator Lacson, you have the floor,
Yes,
sir.
thank you. Thank you, Senator Pia. Magandang hapon. I will just pick up from where I left off, doon sa last hearing. Ito yung sa off-budget accounts. I would just like to clarify na ang hangad lang natin dito, magkaroon ng judicious spending ng pondo kahit off-budget ito. Particularly or especially for humanitarian consideration. The issue that I raised, kasi we're looking at the figures once again, ang nakita natin dito, meron kayong program receipts every year. Kasi hindi pa natatapos yung taon. So definitely, nakaprogram yung, in-expect yung receipts or kikitain ng mga retained hospitals. And then you're also programming expenditures. Meaning, from the expected receipts, you're also projecting expenditures. What we notice, Secretary Duque, and probably the directors of the different government hospitals may respond. From 2017 all the way hanggang 2020, malaki yung masyado mababa yung utilization rate. We're averaging 33.58%, ano? In 2017, for example, ang nagamit lang na from receipts, nagamit lang sa expenditures nasa 17.4%, 2018 46%, 2019 43%, 2020 27%. So, ang main issue ko rito is why don't we just maximize the utilization of retained earnings or yung receipts na tinatawag para pakinabangan na ng mga pasyente na pumapasok sa mga government hospitals. So, ang nakita lang namin, sayang kasi out of the say total receipts of 68.8 billion pesos. Malaki po ito, no, from 2017 to 2020. Yung year-end balance over the same period is 45.4 billion. So ito yung hindi na utilize from 2017 to 2020. Ang utilization rate, sabi ko nga 33.58%, amounting to 23.4 billion lang. So kindly explain this situation, Mr. Secretary. And if I may ask, ano na ng status noong 45.4 billion pesos na year-end balances kung nag-accumulate ito, nasaan na ito at anong pinagagamitan nito? Because do sa circular, yung sinasabi ko circular number 3, no, dated 2013 or 2003, yun yung pinapahanap sana natin kay Secretary Duque kasi yun ang basis ng pag-retain o yung off-budget accounts. So kindly explain, anybody? Thank you.
Madam Chair, maraming salamat po. Ito pong 45 billion 451, yung balance po. Ito po kasi ay retained income ng mga ospital. Sa kanila po yung mga records, but we've sent communication, I believe, to consolidate this kung per hospital, ano na ba yung naging kinalabasan, bakit ang laki-laki pa ng balanse. At tama naman po si Senator Ping na hindi dapat ito hinahayaan na marami pang mga pasyenteng talaga nangangailangan ng serbisyo. Although of course, ang legal basis naman po nito, malinaw din na for MOOE and capital outlay. So may mga programa naman po sila for capital outlay year in and year out, and that's where they use these off-budget items to fund. But yung sa MOOE, mga gamot, mga sari-saring mga gamit, so dyan po ay pwedeng malaking tulong sa ating po mga pasyente. And we will support that, Madam Chair. We will make sure that these items are really meant for better provision of healthcare to our patients, especially because these are government hospitals and presumably most of them are really indigents. And this should help ease the burden of their baka meron pa mga co-payments. We will check that because as a matter of policy, dapat walang co-payment. It's all no balance billing. So tignan po natin ito. Yes, sir.
Very much, Secretary Pingkoy.
Yes, sir.
Ang pattern lang dito, okay na yung projection, ano? Say 2017, 16 billion receipts. Tapos ang pinoproject na expenditure, siyempre may allowance din, baka hindi ma-realize yung receipts, ano? So 13 billion. And yet, ang yung year-end balance, napakalaki. So ang laki agad ng hindi nagamit. Ang laki ng hindi nagamit, I'm sorry. So yan ang nagiging pattern. So tama yung projection, may konting allowance from 16 to 15 and yet 9 billion in 2018. No? 2019, ganun din, 17 billion yung projected expenditures and yet 10 billion yung hindi nagamit. So ito lamang, kindly review this the utilization of the receipts, retained earnings, and probably we can have a response, a feedback from you before the plenary debates because I will ask this again. So yun lang, Secretary Duque. We'll just await the submission of all the details of this retained earnings plus yung year-end balances ng mga public hospitals. So moving on, eto maniningil ako kasi hindi ko na itanong to kahapon during the Blue Ribbon hearing. Ito yung sa mga ambulances. I would just like to clarify because last September 24, if you recall, I raised the issue involving the apparent overprice of DOH procured ambulance with BLS, yung basic life support. Now, October 6, we received from your office yung marami po ito, voluminous yung mga documents which provide explanation on the procurement of the said ambulance. Ngayon, if I may be allowed, Madam Chair, person, i-rebat ko lang. May rebuttal ako rito because lalong nalabuan kami doon sa explanation because yung 2.5 million pesos na cost ng each ambulance with BLS. Ang sinasabi ninyo, yung sinabit ng LGU, particularly in Calabarzon area, 21 lang yung equipment. Whereas in your specifications, yung number of equipment ninyo sa BLS, 30. Now my question is, are we not going to...
already been using your first scan as well. We will update ano po yung mga bago sa kanta. It has been updated last September for the first scan. Your updated last.
Sorry, I cannot...
Your audio is not clear. Your audio is not clear. Can you hear me?
No, I have not yet...
At the end, you will have patients down here.
Chair, may pumapasok na ibang audio,
Yes, and I have
DOH,
not asked my question
HEMB.
yet.
We cannot hear the response. Kindly close. I think you are seated in the same office, some of you, no? So yung mga microphones, mga speakers, pakipatay, and then pakiulit na lang. Who is this speaking, please?
I have not asked any question yet, Setopia.
Akala ko naman may so talagang nagsasalita lang in the background. All right, sir, go ahead,
Yes.
please. Tumahimik na, okay.
Okay. So ang tanong ko, kung ang kine-claim ninyo, 21 lang yung equipment, yung BLS, basic life support, na sinabit o yung binigay sa amin ng LGU, and 30 yung sinasabi ng DOH na dapat nakalagay doon sa ambulance. But initially, they confirmed na 21 against 21. But in subsequent submissions, naging 30 na dapat yung standard. Now, my question is, are you not going to conduct an investigation do sa supplier because it seems that na-shortchange yung LGU? Kasi kung naka-specify 30 BLS equipment, 21 lang pala kasi ginaya lang nila eh. They did not add, they did not subtract any equipment, any piece of equipment inside the ambulance. Ginaya talagang replicated lang nila. So kung 21 lang yung ginaya nila, ibig sabihin kulang yung dineliver noong supplier doon sa mga LGUs. So kindly, and if I may go further, para isang tuhog na lang, namin, inisa-isa namin yung mga equipment, pati yung cost. Now, we'll show you some examples. Halimbawa, next. Halimbawa lang, yung cellphone, yung mobile phones lang. Ito napansin namin kagad. Ang laki ng discrepancy. Ito, 2 cellular phones with SIM cards. Ito yung DOH submission nyo, 30,000 pesos. Ito yung 44A, And yet, yung binili ng LGU, nag-canvas kami, 3,999 per cellular phone. Ang total, nasa 7,998 as compared to 30,000 doon sa DOH specified cellular phones with SIM cards. So kindly explain kasi alam niyo, Secretary Duque, hindi naman namin kayo pinagbibintangan dito. Kaya lang, these are public funds. Ako mismo, di ba, personally, I augmented the budget of the HPEP. Kasi nga para maging compliant na ito sa universal healthcare law. And then I feel guilty when I see some overpricing in the procurement of equipment. This is just one example. Sige, isa pang, this is another item, and I will just show you, randomly. Ano yung next? Yung dashboard camera. Okay, itong bid for DOH 4A, ang dashboard camera, 15,000 pesos. Pero yung retail price, and we're talking here of retail price, 4,500. So right off, parang 10,500 more expensive or 73% ang markup. So hindi ba ito questionable? So yun lang, another item para lang medyo yung stretcher, ito. Hindi masyado, kalahati lang. So 47% ang diferensya sa presyo from 23,800. Yung bid for DOH Region 4A, 45,000. So these are the things that we want to be explained by the department para hindi na maulit. Wag na natin sabihin papanagutin yun. Kasi mahirap aminin water under the bridge. Because these are public funds. Now, yung AED na maliwanag na dapat kasama, yung na-deliver sa LGU, walang AED. So, siyempre, para lang apples to apples, ang ginawa ng LGU, bumili sila lahat ng equipment na wala ring AED. Yet, when we canvass the price or prices of this equipment, nakita namin talagang malaki ang diferensya. So, in sum, parang kung sa suma total natin yung difference, assuming, without admitting, na yung 21 pieces of equipment against 30, alam niyo, diferensya lang, nasa mga 35,000 lang eh. So, which does not correspond to the difference of the price of between 1.5 million and sabihin na natin 2.1 to 2.4 million pesos. So, I will not belabor the issue. Just for future reference, sana man lang maging judicious tayo sa paggastos ng public funds. Mr.
Maraming salamat po, Madam Chair. Can I just say something? Madam Chair, tama po si Senator Ping. In fact, pinagawa ko rin po sa staff ko, sa lahat ng aking mga executive assistants. Pinakanvas ko bawat equipment para sabi ko talagang dito lang natin makikita. So, pinakanvas, so ito yung lowest from the various suppliers. I had like 7 EAs to work on this. Yung pinakamababa nga, 66,875 lang. For equipment cost, 30 items. Yung highest is 365,366. Tapos yung average, 286,181. So, ganun din, doon sa mga online suppliers, mas mababa pa.
Yes.
No? 17,858, yung highest, 172,353 for an average of 152,532. But sabi ko nga, I need the brand. So brand to brand ang comparison dapat kasi hindi mo pwedeng isa mamurahin na hindi tatagal, 2 buwan lang magko-conk out na. So sir, ito ay pinaumpisahan ko na. At number 2 na pinagawa ko rin, tingnan ko doon sa mga procuring entities, yung mga 17 regions, meron din bang mga nag-file ng complaint? Na kasi, syempre, very obvious to kung talagang nag-overprice dito. Sabi ko baka one good lead would be if there was any complaint filed by the other suppliers. So ito po ang tinitignan sa ngayon, but rest assured that we will have this investigated. Kasi nga, this is public funds and we don't want monies to be used and not being able to maximize the value, especially that these are scarce resources, no? So we want to get the best possible bang for the buck, so to speak. So tinitingnan na ho namin ito, Madam Chair and Senator Ping. Pinaisa-isa ko na nga eh. Gaya ng ginawa ninyo, pinaisa-isa ko na talaga eh. Aha.
Thank you, Secretary Pincoy.
Makatulong.
Ito, this might help you, no? Kasi ang ginawa namin, kinambas namin yung actual brand and specs. Yun yung talagang ginawa namin para sigurado lang. Kasi ako, pagka naggawa ako ng investigation, gusto ko yung talagang accurate. Kaya, actual, if you want, we can furnish you para yung
Please, sir.
tulong sa yung investigation. Actual, kung ano yung brand na dumating doon sa LGU, yun din ang kinanbas namin. So, eksakto. And yun nga ang isang tanong natin, kung 30 yung sinasabi niyong naka-specify, tapos 21 lang yung equipment na dumating, na-short change na yung LGU or na-short change yung DOH, as a matter of fact. Kasi ang in-specify natin, 30 equipment. Pagkatapos, 21 lang yung laman. So, these are the things that we should avoid, Secretary Duque.
Yes, sir. We would
sayang po
appreciate
eh.
it, Madam Chair, kung makakuha po kami ng kopya ng inyo
Yeah,
pong...
we'll provide you. We'll
canvas,
provide
sir.
you.
Would appreciate
Kasi
it, sir.
ito pa yung isa, ang canvas namin retail, mga retail prices. Eh siyempre, ano to eh, una-una yung van, fleet. Pag fleet purchase, alam nyo, nung PNP ako, dyan ako maingat. Kasi alam ko pagka fleet yung pinapurchase natin, may mga extras yan. And I would even call or summon the supplier na nanalo sa bidding and tell him in his face, no, na kung merong extra dyan, gusto ko babalik din sa PNP. Huwag kung kani-kanino lang. Kasi alam naman natin yan, di ba? Pagka government procurement, especially complete purchase, may mga extra yan eh. So, iba pang usapan pagka yung when you purchase in bulk, wholesale, mas mababa pa dapat yon. Ang canvas namin is retail. So, para lang, anyway, we'll give you copies of the documents. No? Kasi hindi naman tulad ng ginawa ninyo, and thank you very much na nag-canvas din kayo. But, you know, yun nga, brand to brand ang ginawa namin. Hindi kami nang hula na isa made in Spain, tapos yung isa made in Taiwan or China. Hindi po ganun ang ginawa namin. Talaga eksakto. We made sure na apples to apples yung comparison. Now, okay, so we can expect, we'll provide you as soon as possible, ano, itong aming lahat ng documents, yung canvas namin and all. And I hope before we conduct our plenary debates, ano, in deliberation, and when I asked the chairperson, Senator Pia, maliwanag yung sagot dito. No? So, yun lang, Secretary Duque. So,
yes, sir. Madam Chair, we would appreciate the sharing by the good senator of the canvas documents. Makakatulong po sa amin. Thank you, Madam Chair.
Thank you po. Gusto ko lang makakuha ng update kasi mabilis yung movement ng ating vaccination program plus yung availability ng mga vaccines. Can we have the latest update sa ating vaccination program? Number of vaccines that we have already at our disposal, number of vaccines or number of doses na nakakommit, tapos how many have been vaccinated to date, first dose and second dose. Tapos I understand, I heard Secretary Galvez mention na wala nang priority, no? Parang indiscriminate na yung pagtuturok natin, and that's good. Because parang wala na yung distinction. Are you, by the way, are you agreeable to the proposal made by Secretary Galvez na wag na tayo mag-prioritize kung sino na lang yung gusto magpabakuna at okay naman bakunahan, sila na yung bakunahan para makarami tayo?
Madam Chair, my appreciation of the statement of Secretary Galvez. Kasi nagsimula po yan nung nag-utos si Pangulo na i-open nyo na to the general population. Pero ang pagkakaintindi ko nung binigay po yung marching order na yan, eh tuloy-tuloy pa rin yung prioritization nung A2 and A3, lalong-lalo na po yung mga senior citizens, dahil sila po pinanggagalingan ng mga severe and critical COVID infection at sila po din ang nakakapuno ng ating pong mga intensive care unit. So mataas po ang ICU utilization rate sa grupo na ito ng A2. Kasama na din po yung A3 kasi yung A3 naman ay ito po yung mga individuals with comorbidities, no po? So, yan dalawang grupo na yan ang talagang pinanggagalingan ng malubhang komplikasyon ng COVID infection. Kanya, pwede naman, hindi naman po mutually exclusive. Sabi nga namin, may express lane dapat itong mga priority groups A2 and A3, while meron naman na mataas ang job rate doon naman sa general public. So, yan po ang aking appreciation at sa suma total, ang importante po dito, ang job rate target ay at least mga 1 million a day to as high as about 1.3 million a day. So if we're able to do this, we might be able to actually reach the population protection, yung 50% ng population inoculated by end of December. But our goal is 70% of our population, which is equivalent to 77 million individuals. Baka ho ito ay mag-spill over to early first quarter or February of 2022. So yan lang po, Madam Chair. Salamat po.
Can we have an update, Secretary Duque, just for our appreciation ng vaccination program? If you have. If
Yes.
possible,
Yeah. Meron po.
ano yung
Meron
pinupdate?
po. Meron po. May I ask the Chair to please recognize Yusek Mirna Kabutahe for the updates. Salamat po.
Yusek Mirna is recognized, and then Senator Lacson, I'll give you time to wrap up after that
Yes, thank you.
question. Thank you. Go
Thank you,
ahead.
Mr. Chair. Thank you, Madam Chair, Mr. Senator. As of October 19, 6 p.m., we have the total doses administered 53,315,069 doses jab. Of these, 28,620,352 were first doses po. And yung complete dose ay 24,694,717 ang complete dose. Ang complete dose po yung alam niyo na the second dose of 2 dose and the 1 dose J&J po. Of our vaccines po na total na receive as of October 19, sir, Madam Chair, 91,546,620 na po ang dumating sa ating bansa from February. And thus we are pushing that we improve our job, sabi nga ni Secretary Duque. We are averaging 500. We are pushing it higher if we can have 1 million to 1.5. So that yung difference po, pag makita nyo may 53 million po tayo na job, may 91 million po tayong delivered. Some of these delivered are still in the warehouse. Some of these are for second doses, but we need to push them for the first doses. Madam Chair, Mr. Senator. Thank you po.
Thank you, ma'am. So yung briefing ng DOF sa amin ng DBCC na 195 million doses yung magiging available, yung procured, secured pala. Nasaan na yun? Kasi 91 million lang itong nabanggit nyo na vaccines. Pero ang briefing sa amin ng DBCC hearing, 195 million doses plus ang secured na. Meaning, darating at darating to.
Yes po, Madam Chair, Mr. Senator, tama po. So kung 91 at about, we are expecting about 190. May mga 100 million pa ho na dadating this October, November, and December, Mr. Chair.
Okay. Thank you, Madam Chairman, Madam Chairperson. One last point na lang kasi I don't know if I heard Secretary Duque correctly in the last hearing na sinabi niya merong sa mga government hospitals, merong naka-reserve na 10% para sa yung sa bed capacity. Is that an accurate, baka nakariringgan ko lang kayo. So, tama po ba yun?
Yung pong sa Universal Healthcare Law, yung pong 10% of the total authorized bed capacity ng mga government hospitals are actually authorized for private accommodation. So doon po may co-payment. Pero 10% lang. While 90% of the authorized bed capacity, service bed po yun na dapat
Correct.
no balance billing. Yun lang po.
So, kasama yun doon sa sa receipts na ng mga retained hospitals. Kaya may 10% para naman maski pa paano mayroong income na papasok kasi may co-payment.
Tama po yan. Kasama din po yung sa PhilHealth payment, Your Honor, Madam Chair.
Okay. I won't question that, Secretary Duque, and thank you for responding.
Operation Center. But this time in the COVID response, which is a pandemic and a public health emergency concern.
Meron na naman sumingit. Anyway, Madam Chairperson, that's all for this round. Kung abot pa ako ng third round, meron pang mga ibang tanong. Maraming salamat po, Madam Chairperson.
Thank you, Senator Ping. Let's now go to Senator Nancy. Senator Ping, I have the floor.
Yeah, thank you, Madam Chairperson. I would just like to pursue yung line of questioning ni Senator Ping Lacson pagdating dun sa vaccination. Secretary Duque, based on sa sagot ni Yusek Mirna, we already have 91 million delivered. Tama po ba?
That is correct, Madam Chair.
And yung fully vaccinated ho is already, ilan ho yung fully vaccinated?
20, Madam Chair, may I?
Yes, please.
Okay.
24.6 million, Madam Chairperson, Madam Senator.
Okay, 24.6. And then the first dose?
28.6 million po, Madam Chair, Madam Senator.
28.6. So 24 plus 28. So 52 million na yung, out of the 91 million, 52 na yung natuturok. So meron pa ho tayong natitirang,
Yes, Madam Chair.
more or less 39 million.
Yes, Madam Chair.
And sabi niyo ho, ang vaccination, ang pag daily doses administered natin is more or less 500.
Yes, Madam Chairperson, as of now, but we are pushing it very hard to reach the 800 to 1 million and eventually 1.5 million a day, Madam Chair, Madam Senator.
Sandali. So kung hindi ho natin ma-ramp up yung pagbabakuna at hanggang 500,000 lang ho tayo, it will take us how long?
Until next
78 days. Tama
Yes,
ba?
yes, Madam Chairperson.
So almost mga 2.5 months pa ho bago natin matuturok itong remaining 39 million.
Yes, Madam Chairperson, that's why magpapatawag na po yung ating tatlong secretaries sa DILG and the governors para mabigyan po sila ng mga targets sa Madam Chair at talagang i-push. Ang perception kasi nila kulang pa yung bakuna. Marami na pong bakuna, so they should feel free to vaccinate. We have already opened up po the rest of the adult population, kagaya ng sinabi ni Senator, with priority lanes to our A3. Pero we hope that will drive the immunization faster pag pamilya na po, community ang mababakunahan, Madam Chair.
Pero yung sa kabutahe, alam nyo, may mga nakakausap po akong mayor, ang nagiging problema ho nila, wala hong dumadating sa probinsya nila na bakuna. I mean, they're willing and ready, walang vaccine hesitation dun sa lugar nila, pero ang problema ho nila is the supply. And in fact, ang hirit nga nila sa akin, kung kailangan sila na yung gumastos dun sa pagpapadala ng bakuna sa lugar na, they're more than willing to do that.
We have taken note of that, Madam Chairperson. We are trying to address the several bottlenecks. Some are kept at the PHO, some are not distributed immediately from the PHP, and we are also pushing on the central warehouse so that we can have faster delivery of the vaccines. We have asked the Secretary of Health have asked our regional directors to talk with each of the governor, tell them what is the situation, that there are vaccines available, that nasaan po yung mga bakuna. Some of them are being kept at the PHO and some are being kept at the municipal offices. Kailangan lang pong maging aware and we need to push this po.
So Yusek Mirna, yung nasan tong 39 million? Naka-deploy na ba to? O nasa central
Madam
warehouse niyo pa?
Madam Chairperson, we have an inventory at the central warehouse of ilan yan? 74 million. Madam Chairperson, has already been deployed. So minus 74. About 16 million are already in the region health. Pabayan natin para dapat
Kaya
every
napuputol.
Friday nag-physical
Yusek,
sila.
Yusek, pwede pakiulit
Yes
po
po.
kasi napuputol. Ay, hindi ko hindi
Sorry po, Madam
napuputol.
Chairperson. Sa 91 million po, meron 74 million na po na doses na na-deploy sa buong all over the region, all over the country. So that leaves 16 million po na nasa central warehouse. Ito po, some of them are ini-schedule na po para i-distribute. Some of them have just arrived kasi karamihan talaga ng deliveries within the last week of September and October. So the rest of the doses po are in the regional warehouses, or pag sinabi natin pong regional, nandito sa mga centers for health development, sa regional offices, nandoon sa mga provincial health offices po. Tinitrack na po natin para talagang makita natin kung ano po yung physical inventory na nasa mga PHOs at saka nasa mga regional health offices at saka sa mga municipal offices mismo po.
Yusek, Mira, can you submit that to the committee para pag may mga lumalapit sa amin na mayor, pwede ho namin sabihin na na-deploy na ng central office sa mga lugar nyo. So, baka kailangan lang i-follow up dun sa mga regional offices or dun sa provincial offices.
Yes, Madam Chairperson, we will do that. But we already have an initial submission based on your request last time. Meron na po kaming initial na by province allocation po na naibigay sa inyo. But we will update po, Madam Chairperson.
Yes, I was in receipt of that Yusek Kabutay. Pero moving forward, kumbaga ilan pa yung, kunyari sa next delivery, ito na yung nakaprogram na matatanggap nila. Meron ho ba kayong ganon? Na,
yes,
diba,
Madam Chairperson, we will do that.
You have 16 million at the moment in the central office. So, saan ho nyo i-deploy itong 16 million? And for the succeeding arrival ng mga bakuna, I would assume na may deployment plan na rin kayo for that, kahit wala pa dito. Yusek? Nag-freeze.
Yes, Madam Chairperson. Chairperson, can I be heard now, Madam Chair? Yes po, we will provide.
Okay, thank you. And then, siguro, just to validate yung vaccination rate, sa NCR ho ba, ano na yung natin, vaccinated for NCR? What is the percentage?
For NCR, Madam Chairperson, 90%, yes, and 81% po yung complete dose, Madam Chair.
Yusek, napuputol po.
Madam Chair, the answer was 81.15%.
I'm sorry, my connection is very poor.
Yes. Secretary Duque, yung 81%, that is percentage of the total population of NCR, or that number is just the target, the 70% target or the 50% target?
70% target of the population, Madam Chair.
And what is that compared to the population of NCR?
Would be about, kasi we're talking about about 8 million doses. So,
Kasi di ba, baka
8
magkaroon
million
lang,
individuals.
baka magkaroon lang ho ng,
So over 13.9 million, Madam Chair.
for
Ang target
for
kasi,
NCR population.
yes, ma'am, 9.7 million. This is 70% of the total population of NCR of 13.9 million thereabouts. So ang nabigay na po natin with this is 81.15%, and in terms of individuals, mga 8 million po na individuals ang meron ng 2 jab rate.
But ano ho yan? Pero Secretary Duque, ang ano ho yan is the target population. Hindi yan yung population ng NCR.
Yung target population natin, this is more than 50% na. Kasi 8 over 14 million.
Yes,
8
I
million
think,
over 14 million.
no, I think, Secretary, that is the 80%, di ba? That is the 80%. The 80% is 80% of the 70%.
Yes, that is correct, Madam Chair. 81% of 70%. 7.9 over 9.7.
Siguro, Secretary, let us just be conscious kasi pag sinasabi niya na 80%, it might create the perception that 80% na nakatira dito sa Metro Manila ay bakunado na. When in fact, it's not. It's 80% of the 70% target.
Well, ang sinasabi po namin, Madam Chair, is 80% in terms of communication. Ano po? 80% of the target population. Yun po ang sinasabi namin.
Yes, I agree, Secretary. Ang fear ko lang is baka, alam niyo yung isipin nila na, ay, 80% na pala when, in fact, it's 80% of the whole population, when in fact, it's not the whole population. It's just the target population. Di ba? Magkaiba ho yung ano na yan eh. That is two different numbers, kumbaga.
I agree.
Madam Chair, for purposes of milestones, yung pong 70%, yun ang tinatawag natin na herd immunity. But given the Delta variant, the experts are actually saying that the herd immunity threshold must be increased to about 80 to, in fact, even 90% because of these variants. So we're ready. We're ready for that. We have the doses naman. As correctly pointed out, 195 million doses are expected by the end of December 31 this year. So mukhang kakayanin naman, Madam Chair.
Okay. Yun lang siguro, Secretary. Well, number one, galing na rin naman sa inyo na baka with the Delta variant, there's need to reassess the target. Kasi parang yung with the 70%, mukhang hindi na siya yung tamang percentage to achieve herd immunity because of the Delta variant. So, why don't we just peg it at 90%, di ba? Para, kumbaga, mas realistic dahil nga dito sa Delta variant. Hindi ho nyo ba nako-consider in light of the new variants?
Well, I think, Madam Chair, the fact that we have expecting 195 million doses, that would be about 95 or 97 million individuals. So, abuti naman po yung adjusted herd immunity threshold on account of the more transmissible Delta variant. So, we've already taken this into consideration with the expected total volume of doses for the end of the year. Salamat po, Madam Chair.
Hindi, yun nga. So, Secretary, would we expect a change in the number? Na from 70, gawin nyo ng 90% yung, when you present the data to the public, that the target is already 90% and not 70%?
Tama po kayo. We have to make the adjustments and the communications to clearly point to the adjusted herd immunity target. Actually, 87.25% for a Delta variant with an R0 score of 8. But hindi naman talaga 8 kasi 5 to 8 siya. So parang mahirap din ipeg sa 8. 8 is the worst. But the floor of the transmissibility score of Delta variant is 5 and the ceiling is 8. So naglalaro doon eh. Kaya ang hirap din. Plus of course, let me just inform Madam Chair that basta tuloy-tuloy din na naman pa itong ating minimum public health standards, it will keep pushing down the R0 score. And therefore, the herd immunity threshold may not after all move or reduced, no? It will be reduced kung meron tayong minimum public health standards then. So palagi ko yung gano'n, yung 70 to 90 or
Yeah.
milestones lang eh.
And Secretary, dun ba sa 70 kasama na dun yung 12 to 17? Kasi I remember when you were doing the percentage at the beginning, hindi kasama to, di ba? 18 and above lang. But
That is
since
correct.
nagbabakuna na tayo ngayon ng 12 to 17, so dapat dun, kumbaga, mababago na naman ulit yung total natin.
Maybe, Madam Chair, if we can ask Yusek Mirna, because I cannot recall kung kasama ba yung 12 to 17 years of age. Kasi palagi ko baka nga hindi, dahil at that time, ang policy was 18 years and above. Ano po? So that's equivalent to about 12.8 million children of that age group, yung 12 to 17. So, Yusek Mira, can you just make a clarification?
I just want to manifest that I have the same recollection as Senator Nancy, no? And even yung ibang observations niya, same observations. So go ahead, Yusek Myrna.
Thank you, Madam Chair. Can you hear me now?
Yes, we can hear
Can I
you.
be heard?
But it's soft, so but sige, try to speak louder na lang.
Yes, Madam Chair. Our initial target was 70 million population individuals, which is 18 years old and above. And the 70% is of the target population, which is the target population, is 77 million. But even as pointed out by Senator Lacson during the other meeting, 64% of the total population belong to the 18 and above. So we have targeted 70%, which is 77 million, and 64% of them are 18 and above. We have about 6 million that are already included in the 12 to 17 years of age. And if we raise the target to 80%, that means we will
Yusek, wait lang.
more children,
Yusek,
even the lower. Opo.
Yan, Yusek, mention, nalito lang ako. Pwede playback. Yung 70% nyo na target, hindi ito based dun sa target na i-vaccinate.
Yun po ang target to vaccinate. But initially po, our initial computation last year was 16 and above. So that composed the 70% of the population. But then ang meron lang EUA at that time was 18 years old. And then ang napag-agrihan po na since ang 18 do not need any consent. So we pushed the 18 and above, which is 70 million individuals, which is 64% of the total population. So may
Okay, so Yusek,
yes po.
yeah, so Yusek Mirna, dun sa 70% of the population, ang kailangan nyo na lang idagdag is the 12 to 15. Tama ba?
12 to 17, Madam Chairperson. Some of them are already included in the 70 million. This is about 6%.
Hindi nga eh. Hindi, para hindi magulo, Yusek.
Yes, ma'am. Yes, ma'am. Opo.
Hindi, gusto ko lang malaman kung ano yung hindi na bahagi ng 70%.
Ang hindi po bahagi sa 70%, some of the 12 to 17 and yung 12 years old and below, Madam Chair.
Pero hindi pa naman tayo nag-i-inject ng 12 years and below, di ba?
Yes po, Madam Chair.
So kulang nga. So may kulang dito sa target nyo. will be more than 77 million kasi idadagdag nyo pa yung 12 to 17.
Pag idadagdag po lahat ng 12 to 17, yes, Madam Chair, mag-i-increase ng konti yung ating 70% ng population.
Yeah. Kaya siguro, Yusek Mira, can you just submit to the committee what will be the new number, considering that we already included yung 12 years and above, plus with the Delta variant na mukhang lumalabas, ang kailangan talagang percentage is 90% of the target population. Kung ano yung magiging bagong numero natin. Because para sa akin, kasi ngayon, yung 77 million na target nyo, kumbaga, this is an old target, considering with the new variant, and then nagdagdag pa tayo ng pwedeng bakunahan na age group.
Yes, Madam Chair, we will give you the computation. We will work it out together with our experts group so that we will know the final numbers of what we are going to vaccinate with 12 to 17, Madam Chair.
And then siguro yung Mira, kahit for submission na lang, ano ba yung nagiging bottlenecks natin? Why we cannot increase our average daily doses?
Yes, Madam Chair.
Pag-administer po ng bakuna. In fact, I think bumaba pa nga tayo the past 7 days eh.
Yes, Madam Chair. At one point, we reached 300 to 400, but we are now slowly inching to 500 and we are pushing for higher, Madam Chairperson.
So,
We'll
bakit
give you the process. Opo.
Yun na nga, bakit nga ako ganun na parang pataas na, tapos biglang bumababa na naman ulit?
Maraming factors, but we will submit, Madam Chairperson, the different factors even by region, because specific regions have specific challenges, Madam Chair.
Okay.
With the permission of Senator Nancy, I'd just like to weigh in on that question. No, I think we have to be candid, no, and willing to accept certain limitations, no. At the point where we had a peak in the vaccination numbers, I think that's because NCR mayors and NCR++ have reached that certain level of efficiency, di ba? Ang ganda na ng coordination between the mayors, the vaccination SAR, and kayo po sa DOH, di ba? And now that most of them have reached the target, at least going to that 70%, to be clear about the targets, the 70 and not yet the 90, a lot of the focus now is outside of the NCR++. When I say plus, I include Cebu and whatever other province. And they do not have the same kind of experience yet and have not reached that level of efficiency. So you don't have to wait to submit that kind of details to us. Kasi we can observe that tayong mga nagfa-follow. We know that that's the reality. So the question is, how do you fast track that? How do you make use of the best practices learned in the NCR++ and let them use it so that mapabilis tayo? Diba? Yun. Wala na tayong kailangan gawin pa doon. Yun lang yun. Yun ang the biggest problem there, including the reality that as we get more and more, this is the difficult situation that DOH and the vaccine team face. Sabi nung iba, dagdagan daw yung mga mRNA dahil meron silang mga questions on the efficacy of Sinovac, which, like you, I am a proponent of whatever vaccine is available. It is proven to be effective. Use what is available. I agree. But meanwhile, nagdagdag tayo ng mga binibili natin doon. Pero yun naman, may problema naman may difficulty sa storage and sa transportation, correct? So you have to call it as it is. And that will create more and more problems as we go along. So you have to face it head on. Ako na sumagot Yuse, kasi that's the answer there eh. You don't have to go too much. Bawasan ko na yung mga pending mo na assignment, di ba? Yun eh. Yun. So let's make use of those best practices. Let's put it in place and focus on the next set of issues you have. Back to you, Senator Nancy.
Okay, thank you.
Just add, Madam Chair, that ang isang strategy is really to give quota targets now. Kagaya ng what we did to NCR, may quota per province or at least the major cities And then we are now talking to the different provincial governors and city mayors. They're calling a meeting on Friday para ma-step up po ito. Salamat po.
Thank you, Mr.
By the
Madam
way,
Chair,
Madam Chair, our meeting on Friday will be attended by the governors and mayors of regions 3 and 4A, and we have invited the chair of MMDA and to share the best practices so that firsthand they will be able to listen to what those best practices are to help ramp up their rather anemic coverage. Thank you, Madam Chair.
Madam Chairperson, I think the one that you said is just one aspect of the problem. Katulad nga nung nabanggit ko kanina, di ba, may mga nakausap tayo na mayor. Ready na sila, kaso lang walang dumadating na bakuna dun sa lugar nila. So, that is something na nakasalalay sa DOH kung paano nyo itatransport itong mga bakuna dun din sa mga probinsya. Dahil sila ready na. In fact, marami nang nakapila at gusto magpabakuna, but the vaccines are not yet there. So, isa din yun dun sa dapat tignan siguro ng DOH. Kasi 'di ba, kung hindi nyo i-deploy yung vaccine, walang matuturukan din yan. Mukhang isa din yun dun sa nagiging bottleneck natin is the deployment of DOH.
Yes, Madam Chair, we are checking on that and by asking our regions and our DOH representatives to really look at the different areas. Sino ba talaga ang walang bakuna para mabigyan sila ng bakuna? We have a buffer at the regional offices to address these problems para hindi na po galing sa national. But we will continue to push, sabi nga ni Secretary Duque, so that mag-hands-on po itong ating mga regional directors hanggang sa baba. Maraming salamat po.
Pero Yusek Mirna, from your central warehouse, wala na tayong problema dun sa, kunyari, mga truck na magdi-deliver sa probinsya, eroplanong magdadala to another island. In place na ho ba yung system for that?
Yes, Madam Chair, we just need to push. Ang na-discover nating problema ngayon, pinapahold ng ibang areas kasi wala pa silang storage. Sabi namin, you have to be comfortable, you can use it in +2 to +8, i-job nyo lang and then bibigyan namin kayo. Tapos po yung iba kasi, they are the usual mode, hindi sila yung emergency mode, na pag nandyan na yung bakuna, ibakuna na. So yes, we are also looking at that, Madam Chair, yung transportation mode. Both ng 3PL, third-party logistics ng DOH, and then meron din kasing third-party logistics ang some of the vaccines. This is Swilig. We are looking at the bottlenecks po, Madam Chair. Thank you.
Okay. Thank you. Thank you, Yusek. Moving to another topic. I just have one question sa PhilHealth.
I-wrap up mo lang yung questions, no? But you can have another round. I think it's only Senator Risa here. So go ahead with your last.
Yeah, just one question lang sa PhilHealth.
Ahead.
Kasi di ba meron kayong ano ba yan? Amount na hindi niya na talaga ibabayad doon sa mga hospitals. Tama po ba? Parang meron kayong ganong item. Madam Chairperson, sino pala from PhilHealth yung sasagot?
Madam Chair, PCEO ba? Maybe the very good Senator Nancy Binay was referring to yung denied claims. Yung
yes, and how much is that amount po?
Denied. Let me see. From January 1, 2020 up to October 6, 2021 ay 8.2 billion, 8.3 billion po, Madam Chair.
With the permission of Sen. Risa, can I just finish this line of questioning?
Of course, Nancy. Of course, Madam Chair.
Thank
Okay,
you.
thank you, Senator.
Thank
Risa.
you. Senator. Hindi kasi yung 8.3 billion, hindi ninyo na talaga to babayaran sa mga ospital. Tama po ba? So technically, yung ito ang magsasalunan nito are the hospitals kasi paano po nila hahabulin yung mga pasyente nakalabas na ho sila. Hindi ho ba magiging ganun yung neto scenario?
Madam Chair, merong remedyo po dyan. Meron pang, yung mga claims na yan ay pwedeng i-appeal para malaman natin ang rason talaga kung ano, bakit na-deny yun.
Hindi, pero ano nga, ano yung amount na hindi nyo na talaga kahit i-appeal pa nila, you will not pay for it? How much is that amount?
Madam Chair, we will just submit data on that to the Honorable Committee.
Okay, so sige ho. Kasi for me, Madam Chairperson, ang kinakatakot ko, yung mga ospital baka mag-revert back doon sa sistema na bayaran nyo muna yung hospital bill nyo, tapos bahala na kayo mag-claim sa PhilHealth. Kasi nga, kung lumalaki itong denied claims, I mean, why would the hospital pay for it, tapos hindi nila sigurado na bandang dulo magiging denied claims pala sila. I mean, 8.3 billion is a big amount. So yun yung gusto sana natin na huwag tayong umabot dun sa point na yon na yung mga ospital na mismo yung magsasabi na hindi na namin i-honor yung PhilHealth, kayo na lang ang mag-process on your own to claim yung benefits nyo sa PhilHealth. Yun lang po, Madam Chairperson, and we will just wait for the submission. Thank you.
Madam Chair.
Sir, are you going to respond?
Yung nga po, Madam Chair, kailangan po i-file ang claims, yung denied claims doon sa Claims Review Committee within 15 days from receipt of denial notification po. And tapos, Madam Chair, we will submit
Madam Chair.
Data.
Madam Chair, just to put it in context, Madam Chair, if I may be allowed, Madam Chair.
Go ahead, sir. Go ahead.
Yeah. The 8 billion that was mentioned by PhilHealth, if just an indicative figure, no? If you divide that by the total number of hospitals, which is about 1,283, that would, the financial impact, no, on the hospitals individually, no, would be about 6.2 million per annum. But of course, the bigger the hospitals, in average out ko lang it's the bigger hospitals that will really have the bigger bulk, the bulk of the claims that are not paid for valid reasons. Marami pong rason yan. Maraming kaso, maraming breach of warranties. But just to put it in context, that's the yearly impact kung ganun ang halaga is about 6.2 million. And monthly, you're talking about mga 500,000 a month. Thank you, Madam Chair.
I don't know, Madam Chair, kung tama yung ganung pag-divide. So, yun lang po. Ang sa akin lang is we don't want to be in a scenario na yung pasyente na lang muna yung mag-aabono kasi nga natatakot yung sa ospital na hindi naman pala sila makaka-claim sa PhilHealth.
Madam Chair, yung pong total payout kasi halimbawa last year was about 130 billion So, ito naman 8 billion is an accumulation over the years ng mga denied claims. So, yung malaki pa rin talaga yung natatanggap nila as a percentage of good claims. Salamat po.
Okay. So, but Secretary, on top pa to nung delayed na nga, tapos, di ba, ang tagal-tagal mong inintay na bayaran ka, tapos sa bandang dulo, denied lang pala. So, I mean, it may be little, but it's still an amount that that is due them, right? Lalong-lalo na sa mga private hospitals, negosyo pa din naman po para sa kanila ito eh. So I mean yun lang.
If I may, no, just add to that. There was a commitment, no, to submit a list to that. I'd like it submitted. Can you work together, Secretary Duque and Attorney Giran on this? Because otherwise our colleagues will still take it up during the floor, and I'd like to be able to submit this to them earlier so that they can check it, and if we need to go back to you, we can do that off the record. I'd also like to be sure that that's broken down following Senator Nancy Binay's line of questioning. That's broken down to past dues and current dues. I could understand what you're saying, Secretary Duque, no? If this is like 10 years of claim and let's say a certain percent of that is talagang bad debts na hindi na talaga, wala na kayong intention talagang bayaran because they are not meant to be paid because of erroneous claims, then okay lang. But that should be very clear, no? But let's break it down kasi ang hirap na, it's not fair to you if the public will assume that amount such as 8 billion has not been paid, but it's also not fair to the hospitals and the public that if there is in fact a lot of unpaid amounts yet. So let's clarify that. I understand what you're saying, but we'd like clarity on that, no? So I'll ask for that to be submitted sana within a few days, okay? And then I do have a question. It is in a way a follow-up to Senator Nancy's question. Do you actually have both? I don't know who would like to answer this, no, PhilHealth or DOH, but is there actually an administrative order? I'm not sure if it's PhilHealth or DOH that says that level 1 hospitals cannot accept or cannot treat moderate and severe patients. May ganun ba kayong AO? Or something to that effect? Because I got a message saying that that is the case. And so, anong gagawin nila? We know naman na pag may surge, they will go to any kind of hospital that will accept them. So, is that accurate?
Madam Chair, I think PhilHealth would be in the best position to answer that
Okay.
since they reimburse.
Chair,
This goes not being paid eh. Ang dugtong ito nun eh. Yes, sir.
please ma'am, let's recognize Dr. Clem Bautista again.
Okay, Dr. Bautista, please.
Good afternoon, Madam Chair.
Please speak louder.
Good afternoon, Madam Chair. Regarding the policy, I think DOH issued a statement or a policy on this, such that L1 hospitals cannot treat severe and critical cases. Doon lang po kami nag-base sa PhilHealth. Kaya po hindi rin po namin mabayaran yung mga severe and critical cases sa L1 hospitals. But but moderate cases can be paid po.
So, ano yung hindi pwede? Severe and
Critical cases.
Severe and critical. Okay, let me toss that back now to Secretary Duque or whoever on your team, sir. So if you tell them that they cannot treat, that I'm assuming the reason for that is because they are not equipped to treat. So therefore, what are they supposed to turn them away, especially during a time when there's no other hospital to run to? What happens then? And then if they do treat, I'm sure the exception to the rule here is they can make emergency, right? I mean, di ba sa Hippocratic oath nyo, cannot turn away someone. So, but if they do treat them and they die on them, they cannot claim? Paano ba yun? There seems to be, that seems to be a gray area for me.
Madam Chair, you are absolutely correct. The facility accredited by PhilHealth to level 1 does not have the capacity to manage severe and critical COVID cases. but it does not mean that they will completely turn away these patients. They have to be treated pa rin and stabilized until they are safe to be transferred via an ambulance.
May ibang malilipatan, right?
Oo,
Another
assuming may ibang malilipatan, that is correct.
So, sir, until then, who will pay? Meanwhile, in the days and the hours that they are being treated, who will pay for that? Because PhilHealth just said now that they will not pay for it based on that AO that you issued.
Well, we'll look into this, Madam Chair. It is really a gap that needs to be addressed. I don't know if Yusek Vergere might want to chime in on this, Madam Chair. Kindly recognize.
Because,
Madam Chairperson,
yes, Senator
hindi,
Nancy.
just
sige.
for clarification, ano ba yung difference ng mild sa severe?
So it's
Yung-
mild, moderate, severe, and critical, di ba? Ang sinabi kanina
Yeah.
is yung hindi daw pwede tumanggap ng critical and severe. So ano yun? Yun
So
yung question.
severe ba yung pag naka-oxygen ba? Part ba yun ng severe o moderate lang?
So for our understanding, how do you determine?
Yes, Madam Chair and Senator Binay, when we speak of mild cases are those with usual COVID-19 symptoms without difficulty in breathing. But when we say it's severe already, this requires supplemental oxygen, like they have difficulty in breathing already, and there are other functions of the body which are compromised because of complications of COVID-19, which requires a higher level of facility that can manage this kind of cases. Like they require ICU most of the time, and they will require high-tech equipments like mechanical ventilators or the high-flow cannulas. So we had this issue once early on in this pandemic wherein it was released and what it states there that for those asymptomatic, they should be on home quarantine or TTMFs. For mild, they should be in level 1 hospitals or infirmaries or a TTMFs. And then for severe, you should be in a level 2 or a level 3 hospitals. This was based on the fact that the different levels of hospitals have different capacities. So if you have a severe or critical case, you cannot manage them in a level 1 facility because level 1 facilities do not have ICUs, except for those level 1 which have additional functions such as ICU. They apply for another an augmentation to their license when they do that. But during this time of the increase in the number of cases due to the Delta variant, we have requested from the Philippine Health Insurance Corporation to allow level 1 hospitals to cater to COVID patients because we were running out of beds already. And that was communicated to them, Madam Chair and Senator Binay. So I don't know if PhilHealth, on the other hand, was able to issue out a temporary, or I don't know how they say that, a policy issuance regarding that matter so that we can be able to compensate at least these level 1 hospitals, because this was verbalized and discussed among our League of Provinces or League of Cities, the different local governments, because they were really in need of this kind of reimbursements from PhilHealth during that time. Madam Chair and Senator Binay.
Okay, thank you for that clarification, but that does not seem to be the appreciation of PhilHealth kasi kakasagot lang nila na they confirmed my understanding of the policy as relayed to me, and they said that they based it on your AO, which you have just clarified. So may I then just end this discussion but ask PhilHealth to confirm with me, if possible, within the hearing date today, that this is something that you will clear up kasi hindi yan ang sagot niyo sa akin just now. PhilHealth, yes, you'll get back to me. To us, actually, kasi follow-up lang ako nung kay Senator Nancy. So we can give the floor to Senator Risa Hontiveros while awaiting. Ano na naman sa PhilHealth? Wala nang sumagot sa PhilHealth.
Madam Chair, gusto ko lang sabihin that as a matter of policy, pagka emergency, stabilize muna nung level 1 hospital yung pasyente. Hindi mo pwede turn away yung pasyente. But the emergency Babayaran ng PhilHealth yan as a matter of policy.
Well, actually, sir, in tama naman kayo, in principle, supposed to be bayaran, and that's why I had to say what I did, which is alam ko naman sa mga doktor, yung Hippocratic Oath nyo prevents you from turning away a patient. But the reality is, and I received a message from a level 1 hospital that because of that AO, PhilHealth has told them that they will not be paid. So yan ang problema nila ngayon, na they will not be paid. Sabi, anong gagawin namin sa pasyente ito? Hindi naman talaga nila paaalisin. So they will either not be paid, and that's why I tied it into Senator Nancy's intervention na paano mangyayari to? They will force it upon the patient, right? Because they know that PhilHealth will not pay them. Or what's the other option? You know the other option, they will misdeclare it so that they get paid. So anyway, let me leave the topic, no? But that is the reality, Sec, diba? Yun ang nangyayari. So that's why back to PhilHealth, you have to find a way to address these concerns kasi it was not obviously the intention to tell these level 1 hospitals that hindi kayo babayaran, di ba? It was more like telling them that these are the ones that are equipped, ito ang proper flow ng pasyente, pero nga, you cannot turn them away if nandyan na, which is ganun lang yan. The specific message that I received, paano naman daw ito turn away? Pang 17th hospital na silang pinuntahan. Galing pa from, I think, more than 100 kilometers away para lang silang hanapin. So sabi mo, problema sila ngayon how to book that patient because alam nila hindi sila babayaran. So that is the situation. I've made my point, sir.
Madam Chairperson.
Yeah, Senator
Yeah,
Nancy.
no, can we just get a commitment that they will rectify this scenario and
no, because the reimbursement is on the side of PhilHealth. So
Yeah.
PhilHealth.
and dapat may retroactive to, Madam Chairperson, kasi
Sure.
tapos na yung surge. Well, patapos na, di ba?
Yeah.
Okay, thank you. Again, Madam Chair, for asking the question.
Audio, it's not loud enough, please.
Thank you again, Madam Chair. I was saying,
Yes, President, go ahead.
for asking the question and for us to explain also. Now, as a matter of fact, Madam Chair, the question of the good Senator Binay is very timely. We had meetings, no? We had meetings with Camsor, Camarines Sur, and Oriental Mindoro the other day, one after the other. Sunod-sunod po yan. Because right now, Madam Chair, it has always been our policy to always have a reconciliation of the box meetings with our stakeholders, with our partners. That is the HCIs, the hospital. So yun po nangyari. Sabi nga doon sa Camsor, Madam Chair, na how can we turn down a patient na dinala sa amin dito just because ours is level 1 only. So we treated it out. We treated it. Yes, we treated the patient as required by our Hippocratic Oath. Huh? So yun na nga, Madam Chair. Eventually, maganda naman po. Nag-survive na po ang pasyente. And then the problem lang is that because the treatment involves medical management of severe and critical. So, insofar, Madam Chair, as our policy, we cannot pay it. But, Madam Chair, we came into a what we call this compromise. No? Even the Department of Health at the regions, both in Mindoro at saka Marinduque na. At saka po Camsor, nag-uusap na lang na the Department of Health through the region would issue a certification or something like it will start with a report and then a certification na talagang in that area wala pong ibang hospital. So saan papunta itong pobreng pasyente? They have to treat it out. And it's now the obligation of the PhilHealth to pay. Only that, Madam Chair, we are limited by the policy. Otherwise, kuha naman po yan. And so, yun ang namin, Madam Chair, we will be talking again, we will be meeting again with the hospital, rather the hospital and the DOH, na sana bigyan ng, we have to humanize the law. We have to rationalize the law. Na pag in-okay sa amin ng DOH and I'm asking my boss right now na kung i-okay na sa amin yung certification, bigyan ng certification na yun na nga, walang ibang hospital and other requirements, we will pay, Madam Chair, we will pay. Thank you po.
Nakalagay ho ba dun sa AO, Secretary Duque and Yusek Brihere na do not pay? May ganun ba kayong instruction or that's just their interpretation? Kasi sinabi nyo na pang dalawa, kayong Yusek and Secretary both said that is not the intention. So bakit ganun ang interpretation? I have to say, I'm a little bit disappointed. It's not naman our job to be mediators here, no? It's our job to get clarification lang. Pero right now, we're mediating between the two agencies. Sayang naman ang oras namin.
I will commit, Madam Chair, we will address this expeditiously before the plenary. We hope to be able to iron out some kinks, but it will be for the benefit again of our members that any decision will be made, will be anchored to the benefit of the members. So yun po gagawin namin.
Madam Chairperson, can we just get a commitment na before mag-plenary yung budget nila, and kumbaga okay na, they will already pay dun sa mga level 1 hospitals na because of the surge, they had to give treatment dun sa mga severe COVID patients. I mean, yun yung gusto ko marinig na commitment from DOH and PhilHealth na may makakasingil sila. But apparently, parang hindi ready to commit, Madam Chairperson.
Madam Chair, we would like to be a bit audacious in making a decision like that. But we still have to also consult COA because, PhilHealth has been a subject of several investigations because precisely of some payments done by PhilHealth or policies na favoring the members, and yet we are being held to court or cases being filed. So may COA, ayan, tanungin niyo si President Dante. He's very, very careful about all these COA disallowances, COA. So mahirap talaga. But we have to sit down and resolve this issue with the COA. We will ask also the COA para na sigurado tayo that mahirap naman po, syempre yung mga tao natin, sila pipirma, tapos mamaya sila ang masa-serve ng notice of disallowance. Syempre, malaking bagay din po yan sa ating mga civil servants. So, we will clarify the policy. But ako lang tatanungin, anything for the good of the member, we should always support. But that's easier said than done. Because the implications can be manifold. You have legal implications. You have political implications. Ang dami talagang, so we have to tread on this with a sense of prudence and a sense of, we need to consult with COA. Paano nga ba ito? Dahil masalimuot talaga ito eh. Dahil syempre gusto mo buhayin yung tao. Kailangan bayaran ng PhilHealth. Para sa akin, ang position ko personally, dapat bayaran yan. No ifs, no buts. Kailangan bayaran. But ano yung nitty-gritty nito? Ano yung bandang huli?
Okay. Secretary, sige. Clear naman. Ang point nyo lang is within the legal framework. That's all you're saying, within the legal framework.
Yes,
okay.
Chair.
Senator Nancy,
Just one point, Madam Chairperson. Pero, di ba yung si PhilHealth ended up with that kind of policy because of their AO. So, hindi ba mako-cure ito by coming out with another administrative order? Na siguro may time-bound lang yung AO na to na it will only cover this month or whatever during surge, di ba? Baka yun lang din yung hinahanap ng COA na may ganung cover, kumbaga.
Basically, it's the legal basis. So,
Yeah,
I understand Senator Nancy that if there's a legal basis required, then perhaps the current wording of that AO was not clear enough, and therefore PhilHealth did not feel it had the legal mandate to pay because nga not allowed. So I would assume nga, like Senator Nancy is saying, if that is cured by clearer wording, that the exceptions are emergency care, which you don't need to specify that. Siguro naman alam nyo na as doctors kung ano yun. I would say, but by all means, clear nyo na to, legal counsel, COA, I understand you want to do it the right way, Senator Duke, Secretary. So let's do it that way, okay? So we can move forward. Now,
So, thank you, Madam
I
Chair.
would just like to add one more twist to this never-ending question. Senator Nancy mentioned at least 2 times, but I wanted her to continue before I added the twist. Na liwanagin nyo na basta may surge, pwede yung ganon. Diba? That's what you said, Senator Nancy, something to that effect. Now, I understand, again, based on information I received from a level 1 hospital, that precisely because, and this is the Calabar zone to be specific, was not at some point included in the surge, therefore hindi sila kasama. And yet, yun nga, ika-17th na hospital na silang pinuntahan. So because they are not legally defined to be in a surge, then that posed limitation on their supposed ability to accommodate a patient. So that's another gray area that I want you to look at. Kasi nga, you seem to be very specific on what can be done during surge and non-surge. But the reality is there may be patients that need emergency care, whether you declared it as a surge or not. You know, I don't know, maybe late ang pag-declare ng surge and yet the reality is wala nang tumatanggap na pasyente sa ibang ospital. So napilitan si level 1. So can you include that, Secretary Duque and President Giran in the clarification of these scenarios?
Madam Chair, I have before me the circular of PhilHealth. So nakalagay dito yung package code, yung actual package amount, the severity grading, and the healthcare provider category. No? So nakalagay naman dito yung moderate pneumonia, levels 1 to level 3 hospital. I think the possible compromise here is whatever care that has been given should be paid by PhilHealth. Kung walang ICU, then the arrangements must be done to ensure that a predetermined hospital that has an ICU should continue providing the care upon transfer. So kasi unfair nga naman na hindi mo babayaran tapos ginamot naman nung level 1 hospital, assuming severe, no?
Kung ano man yung I mean, siguro naman, sir, among yourselves, you can determine kung hanggang saan ba yung capacity ni level 1, di ba? And reimburse them appropriately for the limited services that they were able to provide, right? So we leave that up to you. Those are technical details. We just
Yes,
want to
we will do that. We will address it. Yes,
Okay.
ma'am.
Because I'd like to move forward. Thank you. Thank you. I hope I can get an answer within a few days, no? Kasi by November we will be in plenary, so I'd like to be able to share this information with, at the very least, Senator Nancy. I'm sure Senator Hontiveros is also interested, and whoever of our colleagues, no? So let me move on. Thank you, Senator Nancy. Senator Risa, you have the floor.
Thank you, Madam Chair. Siguro 2 tanong na lang. Earlier, Madam Chair, in the earlier round, nagtatanong po ako tungkol sa budget for continuing care interventions kaugnay ng Philippine HIV and AIDS policy. So isang follow-up question na lang tungkol doon, particularly on HIV/AIDS testing and treatment. Nung 2020, nag-target ang DOH na 90% ng mga people living with HIV ay naka-enroll sa antiretroviral treatment. Pero ang actual accomplishment ay nasa 43%. So ang laki ng gap sa target ng actual accomplishment, less than half. Para naman sa 2022, ang target ay 95%. So itinaas. May budget ba para sa ARTs? Ilan ang coverage? At paano maaabot ang target given the COVID-19 pandemic? Dagdag doon, magkano rin ang budget allocated for HIV and AIDS testing kits and paraphernalia? Kasi sa pagkaunawa ko, hindi ka naman pwedeng mag-enroll sa treatment kung walang testing.
Madam Chair, kindly recognize Yusek Vergere of the Public Health Services team.
Yes, Madam
please,
Chair and
Yusek.
Senate. Yes po, Senator Risa, we have a total of 773 million budget for 2022 that was approved in our NEP specifically to fund our commodities, which includes our testing kits. We have several types of testing kits, not just for HIV, but also for the sexually transmitted diseases, which is part of the program. And we have quantities that will be sufficient for us to cover these expanded targets that we have identified po.
Okay po, Yusek. So, 773 million para sa testing kits of sexually transmitted diseases. So, not only HIV.
Senator, Madam
yes,
Chair, I'm sorry.
Yusek. Yes, Yusek.
Madam Chair, yes po, Senator, I'm sorry for interrupting. The 773 million is the budget for our drugs plus the testing kits po, ma'am.
Pati drugs. Meaning, Yusek, para sa ARTs or also for all medication of all sexually transmitted diseases?
Most of these drugs that we procure, Madam Chair and Senator Risa, are really for ARTs. We just procure some types of antibiotics, which is about less than about 5 million for the sexually transmitted diseases, but mostly are for the ARTs po.
So kung Yusek ibawas natin yung 5 million for the antibiotics, so we're looking at 768 million for both testing kits, some testing kits for HIV plus ARTs. Tama po ba?
Yes, Senator Risa, roughly about that amount, ma'am.
Tapos kung kaya po natin, Yusek, na i-disaggregate further, of this 768 million, magkano po para sa testing kit specifically for HIV at magkano po para sa ARTs?
Madam Chair, with this amount, we have about 69 million, which is going to be spent for the testing kits for HIV, and the rest will be used to procure the medicines po.
So kung ganon, Yusek, mga 699 million for ARTs and then the balance of 69 million for HIV kits for the total of 768 million.
Yes, Madam Chair.
Okay, salamat, Yusek. Ilan po yung magiging coverage na PLHIV sa ganito pong budgets natin so far for testing kits at saka ARTs?
For the testing kits, Madam Chair, it's about 700,000 individuals that will be tested. It's a rough estimate, Madam Chair,
Yes,
because
Yusek.
I'm trying to subtract the number of those to be tested for syphilis and hepatitis B and hepatitis C. And then for the antiretroviral drugs, Madam Chair, if I may get back to you, I'll just need to compute for all of this, Madam Chair. About 5 minutes, Madam Chair, if you will allow.
Certainly, Yusek, salamat po kasi even now, no, looking at testing kits for 700,000 persons, and then we'll still, yes, we'll wait for the figure from you kung magkano naman po yung para sa ARTs. At least po we're doing more concrete costing, pero I'm anticipating already. Ibabalikan ko na lang po yung notes ko about what are the magnitude of PLHIVs right now and yung targets, no, at even at the global level na committed ang bansa natin, and probably these amounts would not be enough and we would really need to look at raising those amounts. So but I'll wait for the amount from you, Yusek, kung magkano po ang para sa ARTs. Salamat, Yusek. Salamat, Madam Chair. My last question po for this round would be on the mental health law. Una na po yung regarding yung delayed implementation ng community mental health services. 3 taon na po ang mental health law. Maraming pa rin naghihintay ng full implementation nito. At marami pa rin nagrereklamo na kahit na mismo dito sa Metro Manila, limitado pa rin ang access sa mental health services, mahal ang konsultasyon, mahal din ang gamot. So, what have we accomplished so far? Particularly dun sa provision ng community-based mental health facilities and services.
Madam Chair, Secretary, if I may respond to Senator Ontiveros.
With the permission of the chair, yes.
Yes, please, Madam
Yes,
Chair.
Madam
Yes,
Chair.
Yusek.
Opo. Yes, Madam Chair and Senator Risa, for the community-based mental health program, since we have started, we already were able to train about 50% of our local governments already for this MHGAP, which is our community-based protocol. We have 1,464 rural health units already trained with 2,548 personnel. We are set to finish by the end of next year all of the local governments or the RHU so that we can be able to start implementing our community-based program. We also have e-learning modules so that they can be able to do this online. With MHGAP, we have MHPSS for the workplaces also and for the quality rights. Aside from that, Madam Chair and Senator Risa, we already have 362 access sites for our mental health program commodities that can be accessed by our citizens through the community access sites that we have right now.
Maraming salamat, Yusek. I don't think I was fast enough to note down all the numbers of the items. Kung pwede rin pong hingiin in writing from the department, yung what I was able to catch lang was na-train nyo na yung 50% ng mga LGUs para sa MHGAP. 1,000, was that 1,600 LGUs? Tapos 2,000
1,464, Senator Risa, 1,464 rural health units with
RHUs, okay.
1,548 personnel. And then we are
Yes.
set to finish the remaining by the end of 2022. So it has all been
Alright.
scheduled already.
Alright, good to know, Yusek. And then meron din kayong nabanggit na e-learning. And then very importantly, I think 362 community-based access sites para sa mga MH commodities. In any case po, if we could also have that in writing in our committee. Kasi kapag mas malaman po ito ng mga MH advocates and persons managing our different mental health concerns, sigurado mas may uptake dyan, lalo na sa community level, and pwede ring magbigay ng feedback and suggestions for the further full implementation of the MH law. Huli na lang follow-up question ko tungkol dito sa mental health law on the PhilHealth MH benefit package. Last June kasi, there was a plan to include mental health services sa primary care package ng PhilHealth. So ano na pong mga benefit packages mayroon ang PhilHealth sa ngayon para sa mental health? Yun po bang mga sinasabi ng mga MH users na mahal na consultations, mahal na gamot, kasama na po ba yon sa benefit packages ng PhilHealth?
Madam Chair.
Yes, Mr.
Thank you.
President, Madam Chair.
Thank you for the question. Sa totoo lang po, since from 2019 up to 2020, nakabayad na po ang PhilHealth to something like 198 millions. Para doon lang po sa mga inpatient, yung mga confined na pasyente ng mental health, with mental health cases.
Yes, President. Siyempre, importante po yun, no? Yung coverage natin sa mga inpatient mental health patients. Pero yung mas dumadalas ngayon na sinasabing pangangailangan at gap ay dun po sa mga consultation, saka gamot for outpatient mental health services. May benefit packages na po ba para doon? Para maisama na po yung coverage para sa mga mental health check-ups at saka maintenance medicines.
Madam Chair, much as we desire, patients, outpatients ay yung ano pa, yung polisiya po ay ang ating pang inaaral po hanggang ngayon po.
I see. May timetable po ba ang PhilHealth para ma-conclude yung pag-aaral at makapaglabas ng rekomendasyon, lalo na tungkol sa possible outpatient benefit packages para sa mental health? Kumbaga hindi naman yun magiging lihis sa trajectory ng PhilHealth ngayon. Ano po, dun sa primary care packages nga po na to expand beyond inpatient to outpatient.
Yung
Ang aming programa po is at least ma-deliver po namin yan, Madam Chair, by 2022.
By
2022. Yes,
At
Madam.
kung ganun po, President CEO, kung plano nyo ma-deliver by 2022, nandun na po ba sa proposed budget sa 2022 ng buong DOH and dun sa PhilHealth?
At thank you, Madam Chair. Kung nakita niyo po doon sa aming presentasyon po, nakalagay doon blanco po, meaning to be determined po.
Oo nga po eh. So, yung to be determined na yon, mga kailan po yon? Kasi kung may target naman kayo na by 2022 simulan ito, kailan nyo po, kailan ang internal target schedule nyo na mailabas yung rekomendasyon?
The latest, Madam Chair, would be first quarter of 2022.
So next year pa. Sayang, hindi na aabot sa ating budget process ngayong taon. In any case, in-note ko po yun at tignan ko po kung kaya ko pang i-follow up ito hanggang sa plenary. Salamat, President CEO. Yusek Berhere, gusto nyo ba sanang magdagdag tungkol sa puntong ito kanina, Madam Chair?
Yes, Madam Chair and Senator Risa. I was just going to add that this is going to be something to be discussed between DOH and PhilHealth because the
Okay.
Consulta package is being currently revised right now. And the DOH intends to include this as part of our proposal for the Consulta package. That is all,
Okay.
Madam Chair.
And very good news, Yusek. I really encourage DOH na to push the envelope on this po bilang pagpatupad ng mental health law. So, maraming salamat para doon, Yusek and President CEO. Maraming salamat, Madam Chair. In the interest of time, I will just submit my other questions in writing. Questions po on still on the Philippine HIV and AIDS policy tungkol po sa PNAC and national government agencies program and fund mobilization. A question on the AIDS medium-term plan. Questions on the Sumbungan Board and patient empowerment kaugnay ng anti-hospital deposit law. A question on the PhilHealth package for emergencies. And then questions on the UHC law in relation to the Mandanas-Garcia devolution plan. Lalo na po kaugnay ng UHC phased-in integration and devolution. And last but not the least, Madam Chair, a final question in writing on the COVID-19 National Vaccination Program, kaugnay po ng guarantees para sa 46.37 billion unprogrammed fund. So again, Madam Chair, I'll just submit those in writing. Just as a brief closing manifestation, kaisa ng mga sektor na nananawagang dinggin at suportahan ang apela ng DOH para sa dagdag budget para sa allowances ng ating COVID-19 frontline workers, sa National Vaccination Program, sa pagpapalakas ng ating mga epidemiological and surveillance units, operasyon ng mga ospital at laboratories, at para sa iba pang mahalagang programang pangkalusugan at nutrisyon para sa mga cancer patients and survivors, nutritionally at-risk pregnant women at iba pa. Nakikiusap din tayo sa DOH at iba pang ahensya na higpitan pang lalo ang mga mekanismo para masiguradong nagagamit ang pondo ng tama at nakararating ang serbisyo sa mga nangangailangan sa takdang panahon. In closing this brief manifestation, Madam Chair, alam ko pong mahaba ang mala Christmas wish list para sa kalusugan, and I am painfully aware of our limitations in terms of the fiscal space and the budget process. But I am still hoping that at the proper time, the committee would be able to consider, deliberate, and decide on these budget appeals. Maraming salamat po, Madam Chair, at sa lahat po ng ating DOH resource persons.
Thank you. Thank you, Senator Riza. DOH and PhilHealth are hereby instructed to provide the responses to Senator Riza's questions. Ma'am, maybe you can just give it in writing to your staff so that wala tayong ma-overlook. I would also be interested kasi in hearing the responses, and of course,
Will do,
before
Madam Chair. Salamat po.
If you have follow-up questions, we can help facilitate that for you. Thank you very much. Before we close, Yusek Vergere, I'd just like to get clarification on the rollout of the vaccinations for those minors that you've started last Friday with the 8 hospitals. I recall I read a news article that said that you're increasing the hospitals from 8 to 13. Is that correct? And then on that note, does this mean, and I'm not sure if there was further info that was just not captured in the news, but does that mean for the coming week, and how long will that cover? We will be limiting the access to children with comorbidities to those 13 hospitals. Can you just clarify that, ma'am?
Yes, Madam Chair. Madam Chair, it's really the National Vaccine Operations cluster, but they have mentioned already that they will be expanding. We will be expanding to another 25 hospitals. But if you may allow Yusek Mirna, she can give the complete details for this, Madam Senator.
Okay, sure. Just very briefly lang naman, Yusek Mirna, you're expanding this immediately to 25, and how soon?
Yes,
And
Madam Chairperson.
does this not yet include LGU? So just clarify all that, please.
Yes, the first 8 are identified hospitals. For the next 25, which we are starting on the 22nd, this also includes the identified hospitals of the LGU, and we are trying one area where there is a nearby first aid response, and then we move to the next batch of regions for the 29th, Madam Chairperson. Di marinig.
So I was saying that the news article that I'm looking at refers to 13 more. So it's actually 25 more hospitals.
Yes, Madam Chair, because many have expressed their intention to also join. So we have accommodated them. And for the 8, as long as there are patients that are coming and they would like to continue, we will continue doing the 8 as long as there are patients going to them, Madam Chair. Thank you.
And how will parents with children with comorbidities between the age of 12 to 17 be able to book their appointment? Is that through their pediatrician, or how do you go about this?
There are many ways, Madam Chairperson, like the usual vaccination for adults. They can book through their pediatrician. Some of the hospitals have actually accepted walk-ins. So when, for example, some patients heard about
Are you now encouraging walk-in? Let's be careful with those statements sa hospital yan. So I want to be clear. I'm interrupting only because I'm a little bit concerned when you're saying they're now accepting walk-ins. So are you clear about that you are accepting walk-ins?
Yeah, yes, Madam Chair, but the walk-ins have been referred by their pediatrician, or they have been referred by the local government units, no? We have
So the
already,
hospitals have a way of ensuring that there will not be crowding if there is now. So if a pediatrician can easily refer 50 patients in one day and another pediatrician another 50, the hospital will manage that if they all walk in on the same day.
no, Madam Chairperson, they will schedule, but we are talking
they
about the one or
Where
two
will they
walk-ins that are, yes,
Where will they
that are being
schedule?
accommodated. Yes, Madam Chair.
Where will they schedule that appointment?
They will schedule that with the hospital concerned, Madam Chair.
So do all of these hospitals now have
For the hospitals now.
do the hospitals have hotlines?
Yes, Madam Chairperson, they have.
Have this been printed? I ask you this question very simply because I am very familiar with the systems of the LGUs for the 18 and above. Most of them have done online booking or otherwise some other kind of appointment. Most. I know that there may be a few who agreed to walk-ins, but most only allow by appointment. So when you launched this program a week ago, and I believe Yusek Berhere, you were the one responding to my questions. I said, how will this be booked? And sabi nyo, through the pediatrician or the LGU. Sabi ko, mahirap yan sa LGU because the LGU does not necessarily have a connection or a direct line to that particular hospital kasi walo lang yan. If it is not their hospital, wala silang direct line and they don't know the appointment system. Sure enough, I get my own. Sa akin pa lang. Iba pa yung sa office ko. Ito directly from people who know my number. Magme-message sa akin. Paano mag-a-appointment yung anak nila? Oh, ano sasagot ko? So sabi ko, so tinanong ko yung kapatid ko na mayor ng Taguig City. Sabi niya, hindi pa kami nagva-vaccinate. It has to be with the hospital. So just tell them to go through their pediatrician. So that's all I said, just go to your pediatrician. So ngayon, I will tell them the same thing. Go to your pediatrician. But the pediatrician is not going to make that booking, okay? The pediatrician will just give the go signal na yes, your child has a comorbidity, you may go ahead. So as to the booking, I'm telling you, you need to clarify that, okay? I don't know what to answer to the people. It is not my job. But we, and I'm sure my colleagues here, I saw Senator Risa nodding her head, Senator Nancy is smiling, her usual smile. I'm sure we are receiving the same kind of questions. In fairness lang naman sa mga LGU mayors, they went through pains to come up with this system. And I'm not aware that these hospitals have their system. I have nothing against it. I'm just saying, put the system in place. That's all I'm saying.
Madam Chairperson, can I just share my own experience? Kasi I have, yung twins ko kasi may may comorbidity.
No, go ahead.
Yeah. So like sa Makati Med, they have their own enrollment form that you have to log in. And then you wait for the appointment. So I don't know kung hanggang kailan yung magiging ganyan na sistema for the 12 to 17 years old. I mean, at some point, they have to turn it over sa LGU, di ba?
Also, and we don't know, thank you for that information na ganon sa Makati Med. Hindi ko alam, I have no knowledge kung paano sa ibang hospital. So do we want the mothers with children with comorbidities to call each hospital and find out what their system is? I don't know. That's why I'm asking.
Chair, with your permission, what they were instructed is that the selected hospital schedule their patients for COVID-19 vaccination, either through the pediatrician or the mother can, I know they have hotlines, but I will check. But they are also accommodating the eligible pediatric population with comorbidities that are referred by the city health officers. We have already put the city health officers in touch. So if there is a referral in a certain area, for example, St. Luke's BGC, and the LGU has been approached by a child with, or has seen a child with comorbidity, they will refer this to St. Luke's BGC, Madam Chair. But we will check the system and make it more transparent and more visible, and so that more will be aware. But eventually, Madam Chairperson, as we move to the different hospitals now for the 22, it will be the more involvement of the LGU, Madam Chairperson. And then eventually, it will be the LGU making this arrangements and scheduling with the hospitals. And if we can already permit by the 29th, they can already do it in regular vaccination centers that are near the hospitals, as long as the emergency kits and all the things that we need to prepare for are either in the facility or in a nearby facility. We are moving through that phase approach, Madam Chairperson.
Okay, well, I will just what's the word I'm looking for? Recommend that you check with the LGUs if they have a system in place to refer to the hospitals. Kasi pag online yung mechanism nila, it may be part of their existing system, not a referral system that you're mentioning. And so I just don't want na magka-bottleneck because I know that we're on a time frame, di ba? We want these kids immediately to have access. So just telling you that let's not assume that there is a system in place if you did not specifically ask the LGUs to put a system in place, okay?
We will do that, Madam Chair. Thank you.
Sige. Senator Nancy, do you have any other questions?
Yes, last na lang, Madam Chairperson. Siguro just an appeal. Because I think alam ko dito sa NCR ready na yung mga mayors eh. Baka ngayon pa lang kausapin na natin yung mga sa probinsya para paghandaan na nila itong vaccination for the 12 to 17. Kasi I mean, marami sa kanila wala namang hindi pa sila digital. So siguro Yusek Mirna ngayon pa lang kumbaga ipahanda na natin sila. Yan lang pa, Madam Chairperson.
Madam Chair,
Okay.
yes, we will already do that for the provinces based on experiences that we are going to enhance for the 8 hospitals. We have already identified the regions that are going to start, and it might even expand, Madam Chair. Thank you.
Okay.
Madam Chairperson, last na lang, yung sa senior citizens ba, tsaka dun sa may comorbidity, ilang % na tayo dun?
Madam Chair, with your permission, for the senior citizens, first dose, we are at 44.8%. That's about 3.6 million of the 8.2 million targets. And fully vaccinated, complete dose are 4.5 million or 55%. Mas mataas po yung fully vaccinated kasi mas marami po sa mga senior natin nag-avail ng 1 dose J&J. Sa comorbidities po, mas mataas. We have reached 72% of first dose ating comorbids. That's 6.2 million out of the 8.6 million. Tapos mga 80% na po tayo sa complete dose, 7 million out of the 8 million. So ang kailangan talaga pong i-push ay yung senior citizens and then a little more for the individuals with comorbidities.
Yun na nga, Yusek Mirna, parang parang aliit pa din sa senior citizens natin.
Yes,
parang
that is
barely 50%. Barely 50% yung nagpapabakuna sa senior citizens.
Yes, Madam Chairperson, 55%. That's why we have tried all strategies, and we are looking for more innovative strategies to have our senior citizens vaccinated, Madam Chair.
Okay. Yun lang po. Thank you, Madam Chairperson.
Thank you for that, Senator Nancy. I'd just like to ask DOH now a question that relates to DepEd and SHED, no? Obviously, the health protocols that need to be in place for face-to-face learning, baka interesado ka din, Senator Nancy.
Madam Chairperson, nagugulat nga ako kasi parang 30, I mean from the 120, parang
That's
30 na lang.
That's exactly my question. So, anyway, so far as DOH is concerned, no, because we cannot naman hold them accountable for everything on the part of DepEd. But basically, I'm reading the very same article that you mentioned. There was a news article that says so far only 30 public schools will proceed in holding limited in-person classes starting November 1st, 15. Actually, from what I recall, this was initially announced to be November 7. I may be wrong, but I remember it to be November 7. Anyway, ang objective daw is makabuo ng 100. The 30 are those that pass the DepEd School Safety Assessment Tool coming from the 59 public schools identified by DOH for their 2-month pilot implementation. My question to DOH is, did you, well, you obviously had a hand in identifying this, but did you actually just prepare the framework, or were you part of the team that went around to the schools to check their preparedness for the face-to-face opening? Who would like to reply?
I think the guidelines, the policies have been formulated by the Public Health Services team. Si Yusek Vergere na lang, Madam Chair.
Okay, ma'am, go ahead.
Yes, Madam Chair, we were part of the DepEd and the experts team, which have formulated the guidelines for this face-to-face. But as to the assessment of schools using the tool that they use, it's really Department of Education going around. What we provide for them would be the list of these areas where the schools can open, depending on the alert level. So at the outset, we have initially given them 59 schools from alert level number 2. And out of these 59, they went around, did the reassessment of these areas, discussed with local governments, and some of the local governments apparently backed out because they were not prepared to handle this. And some of the schools, when they reassessed, they were not able to comply anymore with the standards. That's why they announced at the outset they are going to start with 30. But we already gave them a revised list of areas where schools can open already. We will now have 329 areas where they can open schools, and we have submitted it to them already. But as I've said, their process would be that every time that we submit a list, they do reassessment and they talk to the local governments, and that will be their factor to consider if they will include it as part of the opening or not. That's all, Madam Chair.
So what was that number again? 329? Did I hear that right?
Yes, Madam Chair, 329 as of this time. Areas, Madam Chair. This would be the schools that they have included into their 1,000 plus list before. And then we have classified these schools according to their areas. And then every time that the alert levels changes, we include this list or the schools and submit it to them that they can already open because the area has been de-escalated to alert level 2.
Okay, but my question to DepEd during the hearing, and that's why I would like like to ensure, Secretary, that you have a representative there, a senior representative, when we talk about these things. One of the things that we brought up, and Senator Nancy joined me in this, is that what are the chances of opening up in areas such as NCR, which at the time of discussion was still level 4 and now it's level 3, taking into consideration that whether it's NCR or Cebu, there definitely are areas there that I have seen, like in Cebu, I've been to areas that you don't feel like you're in the city. You know, parang probinsyang-probinsya yung dating. It's very isolated. I'm pretty sure that the children in that neighborhood are walking distance because barrio, no? In fact, I would have never found that school if I wasn't literally hiking in what looked like forest. And then biglang, uy, may school doon. So that's one. My second point is NCR that has gone down to level 3. But as you very well know also, the capacity of NCR to respond, no, in case there are situations that need to be responded to, or even their preparation to open up, would probably be much higher than the rest. So has this already been taken into consideration? Because I know for a fact that there are a lot of private schools that are willing and able and want to be part of this list. So I need DOH to weigh in on this, because DepEd is just relying on DOH when it comes to this part.
Yes, Madam Chair, that has been considered, Madam Chair. And actually, what we discussed with the Department of Education, even when we were just formulating the guidelines, would be that even though it is the area is on alert level 4, but there are specific barangays, for example, within a city that is not at that risk level, we can be able to open up the school there. So I guess in the coming weeks, as we give them the expanded list, these areas within alert level 3 or alert level 4 can also be included, as long as the risk level is not the same as the higher risk levels for that specific big city or big municipality.
So very specific example, Taguig, Makati, Valenzuela, wherever, cities in NCR, that where the school and the city, it's the school and the city is ready, and what other standards do you need to see in place there? Are you going to allow? Are they in that list already as of now? Because
Yes,
I feel that we are not approaching this proactively when all over the world they're opening up, and here we are, 30 schools, 30. And I raise this point because the next point I'm going to make, now that there's no other senator, is the effect on the mental health, on how being at home without your friends, without face to face talking to your teacher, how this is taking a toll on the mental health and the ability of children to socialize, to learn. There must be a way that we can move this along, taking cautious steps. 30 schools in the whole country.
Madam Chair, actually the 30 schools has been the decision of the Department of Education.
I'm not
Based
asking
on
that to you, but I'm asking you on the part of the role that you play. So specifically, my question was in NCR.
Yes, Madam Chair. So as I've said, we already discussed this, and we are trying to identify areas currently where the level of risk is not that high.
So for example, for lack of a better example, but I'm not limiting it to Taguig. For example, in BGC, where there's a number of private schools, not BGC, but certain areas of Taguig, Barangay the Fort to be specific, there are international schools and there are private schools. Are you open to that? And I just mentioned that as an example because that's the area I'm familiar with. It could be any other area.
Again, Madam Chair, what we are going to use as a criterion, if ever we are going, if this will be done already, will be the risk level of the area. So we just need to determine the risk level. So if it's BGC, we just need to determine the level of that area, the risk, so that we can say if we can open the school or not. But aside from the level of risk,
I thought, sorry, ma'am, to interject, but I thought Metro Manila is, they move as one. So the risk area of Metro Manila is generally the same, right? So wouldn't the factors that would fall into play there be more like definitely the readiness of the schools? And for example, I don't care if you have certain rules like bawal lang school bus or 20% lang ang school bus, yung mga ganon. I think that would be more important than the general risk of the area, because those kids are not going to mingle with the people in that area. They're not going to mingle with the people in that barangay.
Yes, Madam Chair. Actually, aside from the risk level of the area, there is also the LGU commitment and also the risk assessment done by the Department of Education based on the health safety protocols developed together with DOH. So the readiness of the school is a major factor also, and the LGU commitment. So yes, Madam Senator, we are going to discuss this with Department of Education.
Really wait for this, because DOH, DepEd will always toss it back to you when it comes to the safety standards. I just feel so bad for the millions of children who are suffering at home and the parents who are not able to provide for their needs. Even I, with all my desire, and I come from a family of teachers. My mother is a teacher. My grandmother was a teacher. I pity my 11-year-old son who can't go to school.
Yes, Madam Chair.
What I'm saying is, in the hearing separately of NEDA, you have the whole economic team that's also supporting this. So when you tell me na it's up to DepEd, it's very frustrating for me as the chairman of the committee that oversees the budget of DOH and DepEd, both, to just see it passing back and forth, that there's no sense of urgency in helping these kids find a safe way to go to school. You know what they're discussing in other countries? They're discussing, there's a term, no? I forgot the term. I read it earlier. Something like test now. Because the children, when they go to school, if they are in fact, if they were exposed to another classmate who was positive, they now have a term called, I think, test now, where they will test all the kids and check if who's positive, because those who are not will be allowed to continue to go to school. Nandun na sila sa level na yun. And here we are, we can barely get 30 schools off the ground.
Yes, Madam Chair. Again, we commit to this discussion with the Department of Education. But just to clarify, Madam Chair, the DOH has already given the standards for how safe the safe reopening of schools, the safety standards. We also determine the levels.
You did not from what I know, hindi nga included ang NCR dyan in general. So included na ba? Are we very clear about it na you're allowing it? Because you said, your answer to me a while ago, it depends on the particular. No, the decision way back was that NCR decides as one, or they're dealt with as one. So is my understanding wrong?
Yes, Madam Chair, that the NCR is considered as one. And with this...
Then hindi po accurate yung sagot niyo sa akin when I gave the example of the Fort or BGC Taguig. Kasi sabi niyo, it depends on the specific. No, it does not, because NCR is one and it's level 3. So the question is, will you allow in level 3, and then you go back to ano yung commitment ng LGU doon? Willing ba sila to abide by your guidelines? Open ba sila? The school itself? Yun. So I just feel like there's so much uncertainty here because the rules aren't that clear.
What is clear, Madam Chair, would be that we only allow the face-to-face pilot implementation in the lower alert levels. As to the discussion and the proposal that NCR should be included, and it is in alert level 3, we just need to discuss this with the Metro Manila mayors, because if we consider them as one, alert level 3, then all of them will not be included as one region po kasi.
But you go ahead and have the discussion with the mayors. Why? I'm just basing it on the data I read, diba? Our numbers are going down. The positivity rate is down. The R0 is down. Okay, and once it goes down, we have this window where it will be at the safest, unless God forbid, and we have to be prepared that there will be another variant, right? But historically, it goes down, it goes up, it goes down, it goes up. Ito lang yung window. Pag hindi pa tayo gumalaw nito, and if I look at last year, March and then July. So how many months is that? April, May, June, July. Barely 4 months. And then umakit na naman. So now it's going down. November, December, January, February, March, akit na naman. And then wala pa rin tayong plan sa Metro Manila. So by the time this all moves, we'll say, February, ready na tayo. And then guess what? There's another surge in March. Hindi na naman mangyayari. Why can't we seize the moment and make all the plans planchado, and when it hits a certain level, go? Of course, there's only so much you can commit to because I have to talk to DepEd about it. But this is my problem. There doesn't seem to be urgency. When you tell me that you'll talk to the mayors, you should have talked to the mayors. You should be having these discussions. Because it's going down. Don't wait for the discussion to happen when it's already down. To have the discussion now and have that goal. So what are we? What was our number today? 4,000 ba? 7,000? Nalilito na ako. What was that number? So like, baka it's possible in 2 weeks we'll be safe to open. What schools have been checked? None. Because we haven't had a discussion, Secretary. Do you hear the what's the word I'm looking for? The lack of hope in my voice.
Madam Chairperson?
Yeah.
Hindi,
Senator
can I just add? Kasi hindi lang DepEd din yung hindi nagbubukas yung pasok eh. Even CHEB, even TESDA, hindi pa rin sila fully face-to-face. So yung problema is not just with DepEd, but with all our learning facilities. Hanggang ngayon, sarado pa din sila. Or very minimal yung allowed to open, right?
Agree. And especially when it comes to TESDA, pwede naman yun na outside of the classroom. I cannot see how that has. But again, we do not lump on DOH the problem of these other agencies. But we're just letting you know that we feel very strongly that it also has to come from you. Secretary, the mental health problems that we are hearing about, no? I get this and I'll send it to you because I got a very interesting proposal on how to help children cope with the situation they're in, because there's so much anxiety among kids, depression, even suicide rates, unheard of in the past, and brought about by isolation, brought about by lack of social contact. So even this alone should spur us in that direction.
Yes.
Fast enough.
Yeah, Madam Chair, I see clearly where you're coming from. My position from day one has always been to allow the resumption of classes as far back as June last year, when we have identified MGCQ areas, yung low risk, ang daming low risk areas eh. But we cannot go against the presidential directive. Ang gusto ni Presidente, mabakunahan muna lahat. So, ang hirap naman ito na talagang naiipit din kami. Sa totoo lang, we have already explained, matagal na yung mga low-risk areas, magbukas na. Kasi ano ba naman, di ba? I mean, why? Ang hirap na i-discuss yung obvious eh. Low-risk areas eh. Pero syempre, may policy eh. We have to follow that, di ba? Hirap. Even DepEd has wanted to open. Sa totoo lang, has long wanted to open. Sa totoo lang.
Oh, pero sir, the policy now on the health side also has to come from you now, di ba? If you're acknowledging that you're wanting to open, then kayo na rin mag-spear nung na, we have to bite the bullet at some point, right?
Yes, ma'am.
If there will be some positivity, like I said in a previous hearing, you know what the Prime Minister of New Zealand says? We're shifting from zero COVID to living with COVID. And you know what? We will have increases in positive, but that's okay. We will handle it. Ganon. Kasi otherwise, magto 2 years na itong mga bata na hindi nakakapasok. And I am in misery. I am in despair thinking of it. So, Senator Nancy, if you have the last word to say, I will leave you on this. Secretary Duque, can you please proceed with meetings with the Metro Manila mayors, the Metro Cebu mayors, and so on and so forth, and come up with a plan, please?
We will do just that, Madam Chair. So we have listed down all the points that you have raised, all very valid indeed, and we are one with you in really wanting to open up the face-to-face classes. We all know, lahat tayo may anak eh. Lahat tayo, ako may apo. Lahat ito, nakikita ko when I go home, the kind of behavior my grandchildren display. I'm really worried. I mean, and you don't need to, parang talagang hirap, but we will do that. Ganun lang. We'll be more aggressive in the, now that the vaccine supplies have stabilized. I think this is going to be substantial in terms of the decision to open up more aggressively, more quickly. But we will put together that plan with the DepEd. In fact, sa DepEd nga, I was hoping to see a list of teachers, how many teachers have already been vaccinated with second dose, how many, but I really still don't see this. Yung sa teachers, for example, we have to make sure that DepEd monitors the number of teachers that have already had the second dose coverage, no? Kailangan lahat talaga should be governed by targets and timelines and outcomes. Kasi kung wala, we're all leaving it to chance. Eh, hindi naman pwede yun. Basta ako, sinasabi ko sa inyo, basta MGCQ, Loris, bukas. Talagang
Yeah, but they should be ready kasi yung problem, it appears to me that the discussions only happen when we're there. So like when I hear that only level 2 can open, para bang, so there's not even any discussions with those in level 3 so that as soon as it's level 2, open kayo agad. Yun yung
Yes.
yun yung nakita kong gap dun eh.
Yeah, we agree. Yeah, we will address
siguro-
that. We will meet with them, Your Honor.
Senator
We
Nancy.
will meet with them.
And Madam Chairperson, siguro just to add, kasi I guess yung frustrating is yung parang wala pang ready na protocol on how we can open safely. Pag ready na, the next day pwede na sila mag-open kasi yung classroom na naayos na at a certain way, yung kung ilan yung pwedeng pumasok during this time period. 'Di ba? I mean, kasi parang wala yung reassurance na the protocols are there to ensure na ma-minimize yung spread ng COVID. I mean, kahit ako as a parent, hanggang hindi ko rin narinig kung paano pag nag-open na nga yung eskwelahan ng anak ko, ano yung magiging health protocols na i-impose ng DOH tsaka ng DepEd. Parang walang ganong
Pero no, I'm
information
sorry.
dissemination on the ground, which I guess siguro nagkakaroon din ng hesitancy yung mga ibang magulang na papasukin din yung mga anak nila kasi parang kulang eh. In fact, in our hearing sa NPA, you asked for that, di ba? Ano yung, and what is expected from us parents pag pumasok na yung anak namin sa eskwelahan? Do we have to monitor them, di ba?
Parents, di ba? And then
Yeah.
what do we, and then kumbaga it's a contract between me and the school. What is my participation there and what is the school's participation? Wala naman ako naririnig. So in as much as I wish for the school to be included in the 30, in the 100, so far there's no preparation because wala namang sinasabi si DOH and DepEd na ito na yung mga protocols and all you have to do is wait for your school to be included. So it's the communication, it's the marketing of the idea. If it's putting the confidence in the teachers, in the administrators, in the parents that this is going to be okay. And we may have setbacks, but we can move forward. No one's doing that for us, Mr. Secretary. And if I may end, I will have to close this. It's almost 5 o'clock. 2 more points, Mr. Secretary, in the same area about the welfare of children. Parks. Now, tomorrow we have our hearing with CHED, and I'm going to ask what has been the policy of the SUCs, of the state colleges, in opening up their schools, particularly those that have big open areas, that can serve as park and open areas for families, for elderly, and for young people. Diba? The school may be closed, and hopefully not for long, but at least magamit naman yung public pa rin yun eh, di ba? Those are public areas eh. Magamit yun. Kasi I've heard, but I will get an official answer tomorrow, na some of those are closed. Number 2, discussions of safe activities for kids. Yes, I know that we have now allowed kids to go outdoors, right? So obviously, if you're with a parent, okay yan. But what about now the discussion? I'm not saying implement it tomorrow, not next week, but the discussion on safe, non-contact activities for 18 and below, 17 and below. Diba? I can understand for being in a closed classroom, indoor, that's a little bit different from being outdoor. Of course, I prefer school before extracurricular. But if there's a safety issue with the school, what about just these other activities that may be safe to allow that interaction and that mental health component to be addressed? So whatever that sport is, whether it's football na non-contact, whether we're saying the coach is only allowed to have 6 players and they must never be more than 2 meters apart, hindi ba tayo pwedeng mag-isip ng ganyan? And allow na the barangays to have something na on Mondays, it will be age 15 to 17. It has to be supervised so that walang contact, walang typical basketball, hindi pwede yon. Pero pwede kayong supervised, they can have outdoor activities. Kasi not all parents can do that. It's not enough to say you're allowed to step out with your parents. A lot of parents work. They need social contact with the other kids. Can you work on that, Mr. Secretary? Can you ask your team to work on that, please?
Yes, we will do, and perhaps we'll get our experts as well on board as to the risks that certain activities will bring, and how to manage this, and to make the adjustments. We don't close the doors. We welcome all of these, and if there are some refinements that need to be done, then we'll do it. But the always paramount consideration is the safety.
Of course.
Yes.
That discussion. So why don't you
We will.
engage UP College of Human Kinetics? No, they're the paramount expert when it comes to sports and recreation with your DOH infectious disease and epidemiologists and whoever other experts to decide on what are safe activities that kids can do outdoor with supervision short of going to class. Because we're not moving forward at this point. Okay?
Yeah, we'll do that. That's what I meant when I said we'll get the experts on board, so we'll be guided. So a lot of this is beyond us, so we need really genuine, credible experts to give us the best possible advice, and we'll do it, Madam Chair. Thank you.
Yeah. So on that note, I will adjourn this hearing, but you do have these pending issues, no, that need to be responded to either in writing as expressed by certain senators, and even although I will adjourn it, I may require a further online briefing, no, to address these concerns, Mr. Secretary. Okay. So on that note, the budget of the Department of Health, Office of the Secretary, its attached agencies, National Nutrition Council, Philippine Institute for Traditional Alternative Healthcare, Philippine National AIDS Council, Philippine Health Insurance Corporation, NKTI, Philippine Heart Center, Lung Center of the Philippines, Philippine Children's Medical Center are all deemed submitted to the plenary, subject to the discussions and the requests for documents and clarifications. So thank you very much, Mr. Secretary, PhilHealth, Attorney Giran and team, and we will continue to have our discussions. But your budgets are submitted, and we will work on our committee amendments. Thank you, everyone.
Thank you very much, Madam Chair, to the Senate Committee and also the DOH team and PhilHealth and the rest. Thank you.
Thank you.
Thank you.